Hello. This is Dr. Garrett Smith, also known as the nutrition detective around these here YouTube parts. And for this week's live stream, I decided to go back and redo one of what I consider my most important videos, which was where we're going to show that the science on vitamin A deficiency is very untenable and sus, and how pretty much all vitamin A deficiency symptoms, you could summarize it as a lack of meat. Really. Protein, zinc, taurine. You can show that all vitamin A deficiency symptoms can come from any one or multiple of those things. And yet none of these things are ever evaluated in studies. So we're going to go through that, and we'll go into the old video of me. You'll get to see me from like 5 years ago a little bit, and you'll get to see the research that I had 5 years ago, and then I went above and beyond and got even more research showing this whole farce. Now remember, the Rockefellers sponsored the original vitamin A research. Do you want to know why they sponsored the original research to find a vitamin? This is the legit story. So the Rockefellers were into pharmaceutical medicines. They were trying to create drugs. And what they suspected was they were like, we're going to run out of, back then, they literally thought, we're going to run out of drugs to make. Like, we can only make so many drugs. So we need to find something that's in food, and they're particularly into dairy. We need to find stuff in food that we can convince people they need more of. And so they started funding research into dairy. Funny thing, the very first vitamin that was discovered was vitamin A, and they call it A because it was the first one. Okay, and then there's D a little bit later, which is also found in dairy. And they had a big thing about calcium too. Like, you have to get obscene amounts of calcium. That you go look at the calcium RDA, and you'll figure out that there's no way in heck that a human can get enough calcium from foods while excluding dairy, if you go by their guidelines. So wait, you need a bunch of vitamin A, you need a bunch of vitamin D from food, you need a bunch of calcium. Weird that those are all in dairy, right? The Rockefellers have nothing to do with profit motive or making sure you're buying their stuff on bad science, because pharmaceutical science is bad science in general. Anyway, while we're on the topic, those of you who are doing the KG Lipid Cleanse, or if you just want, I found this thing while I was looking around on the interwebs, as I do, but if you want to get a FibroScan, okay, what's a FibroScan? It is, I believe it's ultrasound. I haven't looked into it that deeply, but it's a liver scan, like a literal scan of your liver. They can look for fatty liver, they can look for cirrhosis, they can look for all these other things. So let me show you what I found. You can possibly, depending upon where you live or how far you're willing to drive, you may get it for free. Now, I'm going to tell you there's some stuff here. So what I did, I'm in Tucson currently, so I was looking this up for somebody. I looked up self-pay FibroScan, right? Because I figured I wasn't going to go through my insurance, and people were asking me about it. So I just looked to see, where can I get it in Tucson? Okay, so what does it cost normally? $2.99. Free options. Wait, there's a bunch of free options in Tucson. So you can get here's a free one at Arizona Liver Health. All eligibility requires 18 years or older and fasting for 3 hours prior to the appointment. That's easy. Nosotros program, free scans to help identify stuff, but a specific focus on a Hispanic community. So if they were to tell me I couldn't get it, well, that would be racist, wouldn't it? Which would be humorous. There's another research place, year-round free FibroScans in the Tucson area without participating in a clinical study. And El Rio, which is a big thing here in town, again, free. Now, somebody's going to say, why is it free? That should be the first question, right? As they say, if you're not paying money for it, then you're the product, right? This is what social media is. Social media is just an ad machine. And so if you're not paying for it, they're using your information to make money to sell to marketers. So if we start going, why are they giving away all these liver scans for free? They're probably going to use it in a study. Okay, they're not going. They'll probably anonymize you. They won't know who you are. They'll just have like your age and whatever. And so they're probably using it somewhere to make some database of Americans and their liver conditions, and they're selling it somehow. Am I worried about that? This is like, okay, folks, some of you out there worry about the stories of the elites are drinking blood. They're drinking the blood donations. Okay, first of all, like Kelsey was telling me that some of the stuff, there's theories that porta potties, they're literally collecting the poop in there and doing biome studies on it. They're doing bacterial studies on it. And that's one of the reasons they put a bunch of methylene blue in there, is as a preservative to help them do all these biome studies. I'm like, okay, I got to poop. Like, I need to put it somewhere. I'm not going to put it on the ground. So why not in, well, here's the idea. Am I going to avoid using porta potties because they might be doing strange research on the bacteria in my poop? No, I'm not going to avoid using porta potties. If I have high ferritin and I want to donate blood, or I want to donate blood for some other reason, you're a guy on TRT because you haven't done enough of our stuff yet and fixed your testosterone, which we do. But anyway, whole nother point. You're a guy on TRT and your blood's getting too thick, if you will, too thick from the testosterone. And you need to go donate blood. Like, you can donate blood. What happens to the blood afterwards? Like, okay, here's the idea. Are you going to have your health suffer because you don't want to donate blood because you heard some stories on the internet? Or do you really care what happens to it after that? If they're helping you out, if the process is helping you out, what are you worried about? So if they're going to do a FibroScan for free, I mean, you can pay for it. Then you're definitely not in the clinical study. You got an extra $300 to throw out there, go ahead. But if you want a free one, and I looked it up in Spokane, Washington, because that was the closest big city to where Kelsey lives, and I found that you could find free ones in Spokane. So what I'm saying is that if you live close to a bigger city, at least a decently sized city, go search like free FibroScan and the city, and you may be able to find it. So if you're going to do the KG Lipid Cleanse, if you watch that episode from 4 episodes ago maybe, and you want to do it and you want to get a before liver scan and an after liver scan for free and help us out to show that we're doing good work, then that's one way to not add costs to you. And if you're going to do that, email us and tell us. Oh, another thing, folks, if you're having any trouble with the VIP store, remember, if you want to go check it out, we just launched the new website today. So, Joe, the links should all be the same for what you're using. But anyway, the new website, it looks pretty cool, is up today. We've had a little issues with some of the software on the VIP store. So if you're having trouble with the VIP store, don't freak out. We know we're going to fix it. We're in the process of fixing it. Just, you can email Julie and tell her that it's going on, but we don't need everybody emailing because we already know that there's a little snafu with like the extension or whatever that isn't Kelsey so cute. Anyway, so just go check it out. I think it looks pretty good. We wordsmithed it and all that stuff and got it pretty. So you can go check it out. But so we got the self-pay FibroScan stuff, or the free FibroScan stuff. And Joe, if you can, let's bring up that old YouTube video. So what we're going to show is we're going to show you the YouTube video. So this was me. That's a great.
Today I have a presentation.
Now I got the echo.
Where
that's a great picture of me from
that demonstrates that what we call vitamin A deficiency doesn't exist. Let me get into that presentation right now.
So anyway, Joe, that's probably good. So anyway, that was me from 5 years ago. I'm 50 now, so I was 45 then. So you can tell me whether you think I look better than back then or not. And then all the people who, all the haters of the vitamin A is toxic movement, I mean, they can wonder why I'm not falling apart. Why are we not falling apart from a low vitamin A diet? Because there was never vitamin A that we needed. So people out there, I'm going to tell you, and I'm going to add, okay, so I want to first say this. Matt Stone is a good buddy of mine. And he did a video. I've talked about this before. So this is nothing against Matt. He's doing, in a way, he's doing science. He absolutely is doing science. As you're going to see in this, he tried to make his diet as low in vitamin A as possible. Like, noble pursuit. I would have warned him away from it a little bit, because even in the research back in like the 50s and 60s, the researchers said if you try to do a vitamin A deficient diet that's as low as possible.
These 100% grass-fed.
What is that, Joe? If you're trying to do something that's as low as possible, they said you're going to create other nutrient deficiencies along the way. Well, one thing, Matt and I have conversed a little bit, and he hasn't tried the zinc supplements yet. Okay, that's his decision. But he is grokking. He is totally seeing the nickel toxicity, which again, some of his choices for his extremely low vitamin A diet were quite high in nickel. So not only was he potentially zinc deficient, but he was eating a lot of nickel, which then can deplete the zinc further. So what happened was he got some night vision issues. And so, of course, the vitamin A is amazing. The haters of our movement were like, they're jumping on it. They're like, yeah, totally. And I'm like, still zinc. I'm pretty sure it's still zinc deficiency. Zinc is antagonistic to nickel. We got a huge thing going on. So, oh yeah. So chats today. We have 7 pages of research studies to go over. I'm going to try to go through them fast, and you guys can look them up if you want, but I got 7 pages of research studies. So please, I'm not going to be hitting regular chats. If you give super chats and they're not too long, I might get to them, but don't plan on today being a lot of live chat stuff. Okay. We got far too much to do. So, okay, Joe, a super chat from Albert Kuiper. We'll just hit this real quick. Could I please share your opinion on using tretinoin and retin-A in gel or cream form for facial skin care? I have been over this before. It literally murdered U.S. military veterans using it on their face. There's a large study that they stopped early. They gave these U.S. veterans retin-A creamed or gel or whatever to rub on their face to prevent skin cancer. Did it? Well, they stopped the study because too many of the vets who were getting the retin-A were dying early. So, no. And now, I don't have this study brought up, but now there is, if you look on PubMed, those of you who like to look, go look up magic vitamin A. Magic vitamin A. They're literally calling it magic in the research. It's 2 tretinoins bound together. It's 2 all-trans retinoic acids, 2 retin-A molecules bound together, and they're calling it magic vitamin A. And when you look at the research on the cytotoxicity and the cell viability, as in the survival of the cells, magic vitamin A has the least viability and the most toxicity of all of them. And they're just like, well, yeah, it's a little bit more than the other ones, but it's okay. And yeah, no, retin-A is a disaster. You are absorbing it in your system. And the veteran study here, let me just, I don't want to bring that up. I got too much to go over. You can find it. Go chat GPT. Hey, was there a study where they looked at U.S. veterans using retin-A or tretinoin? And you'll find it. Maybe I'll do that again in the future if it was in another video. But yeah, no, it's poison. It's absolute poison. Absolute poison. You may get some benefits from it for a while, and they'll be gone. And then you'll be left suffering. So, oh, Joe says we're having some issues with the video. Let me see if I can close anything, Joe. Closed that. My AI database updating is stopped. Let me take this off. Joe, I'm not running anything that I can see. Okay. I closed everything. So, okay. So here, let me share. So if you can share my screen, Joe. Let me do view and full screen. So this is, as we put this in, I put this in the live chat. Or Joe, did you put this in the live chat yet? I'll just throw it there if it's not already there. There it is. Joe put it in there. Okay, great. So this is what we're going to go through. And hopefully by the end of this, you guys will understand. Now what I'm going to say first, you must understand something, because if people go, well, vitamin A did this when they gave it, there's something very strange about the relationship between vitamin A and zinc. Does vitamin A do stuff? Does it do things? Yes, it does. What I've come to the conclusion of is that vitamin A, given in high enough doses, will cover up some zinc deficiency symptoms. Okay. So why are people using Retin A on their faces? Because it does something. It does something to their skin. Why are people taking Accutane? Because it literally breaks your oil producing glands in your face so you stop getting acne, while it's breaking your liver, while it's causing birth defects, while it's causing fertility problems in teenagers who should be the most fertile that they ever are in their life, and it's breaking their fertility system. So does vitamin A and vitamin A compounds do things? Yes, it does things. So does apparently compounds derived from Gila monster poison. Those are called GLP-1 inhibitors or antagonists or whatever it is. Semaglutide, retatrutide, like they do things. They're literally poisons that do things. Okay. Nobody has a deficiency in bee venom, but can people use bee venom to do things? The whole pharmaceutical industry is based on toxins that do something in the body. Does that mean they're good for you or that you need them? No. So the argument is not that does vitamin A do nothing. That's not what I'm arguing. We're arguing that what are called vitamin A deficiency symptoms are BS, and they're symptoms of other stuff. So could you take vitamin A to cover up symptoms? Of course you can. What is Retin A doing? Do you need zinc to help prevent acne? Yeah. Oh, wait. So they use isotretinoin, 13-cis-retinoic acid, which is made from vitamin A in your body, to shut that down. But they really need zinc. Almost every symptom that you can find that is attributed to vitamin A deficiency can pretty much be found as a zinc deficiency. And I'm going to show you that. Okay. So let's head into it now. Let's go to the first one. Joe, make sure you hit me on the, I'm going to have to click on all of these things. Oh, I got to do the whole thing. I got to get all the flock cameras in here too. Cars. Oh my gosh. The internet is becoming like practically unusable. I think they want it that way. So this paper, Carotenoids. That's the whole name of it, Carotenoids. Very, very original. First thing you must know, all vitamin A that you would call retinol or retinoic acid or retinaldehyde, all the retinoids, they do not exist without carotenoids. So people will be like, animal vitamin A and the retinoids, and they don't exist without carotenoids. So all vitamin A, for those who are carnivore out there, who think that plant foods are full of so many toxins, vitamin A is one of them. Carotenoids is one of them. All it's gone through is one step to turn it into retinol from a carotenoid. So let's go over, why would vitamin A be necessary, essential, if carotenoids aren't then? Where do you think cows get their retinoids from? Carotenoids. Do cows need, as an adult cow, do they need to drink milk or get other vitamin A from animal sources? No. Can humans convert carotenoids or detox carotenoids into vitamin A? Yes. So let's just read this here. None of the carotenoids are considered essential nutrients. None of them. No carotenoid is directly involved in a vital metabolic pathway, nor has the relative absence of a carotenoid been linked exclusively to the induction of a specific deficiency or chronic disease. Hence, the lack of FDA-approved health claims. So the FDA won't even let them do health claims for carotenoids because it's not essential. And it's not directly related to anything. So if carotenoids aren't related to this, the stuff downstream, it would be like, oh, alcohol's not essential, but acetaldehyde is. No, retinol's not essential, and retinaldehyde isn't, but they all come from, remember, a carotenoid is 2 retinaldehydes, I believe. If I recall correctly, yes, it's 2 retinaldehydes. A carotenoid is 2 retinaldehydes bound together, and then we cut them apart into 2 retinaldehydes. Do we need aldehydes to live? No. So let's keep going now. So carotenoids, we start off with, this is shaky footing. Now I want to show you, because we're going to be going into the vitamin A deficiency literature, I'm going to show you that when the Cochrane Institute, the Cochrane reviews, when they went into assessing the legitimacy of serum retinol testing, serum retinol binding protein testing, all of these vitamin A tests, wait until you see how many false positives they got for deficiency. So that means a false positive for a deficiency would be, they're saying you're deficient when you're not. It's really bad. Okay. So here we are. Selected laboratory-based biomarkers for assessing vitamin A deficiency in at-risk individuals. Let me find it. So they have some dumbed down stuff here. What are the most accurate tests for diagnosing low vitamin A? I think they went through 40 studies on this. Key messages: the 2 most common tests, serum or plasma retinol and retinol binding protein, cannot reliably identify at-risk individuals with or without vitamin A deficiency in the community or clinics. Did they really just say that the 2 most common tests are worthless? So all the science that all the vitamin A lovers are basing their stuff on, the tests are worthless. Wait, I'm saying it's not vitamin A deficiency. I'm saying it's something else. This may mean that using these tests could lead to over or underestimated levels of low vitamin A at the population level and incorrect diagnosis of individuals. Now, people will say, well, Dr. Smith, why do you test serum retinol? Because we don't take it too seriously, but we watch it over time. We're not trying to look at one test and say, oh, you're high or you're low, or we're not trying to take one test. It's watching it over time where we can tell things. Okay. So basically, vitamin A testing is worthless. So when you see what we go by is symptoms. Oh, we're going to go into symptoms. Okay, great. Joe says the video and audio are good now. So let's get into this. SR means serum retinol. So that's the blood vitamin A test. Retinol isotope dilution. This is where they're giving retinol to people, retinol supplements or retinol palmitate that's literally marked like a radioactive isotope of vitamin A. Okay? 23 studies. So look, pay attention here. In 1,000 people where they're stating this, where 100 of the 1,000 people, this is the when they went through the research, this is the theoretical statement they're making. Okay? In 1,000 people where 100 of them have vitamin A deficiency, so they're saying in this fantasy world, they have vitamin A deficiency. They're saying we know that 100 people have vitamin A deficiency. And they measured them with retinol isotope dilution, which is considered one of the best tests out there. 82 people of those 1,000 would have a serum retinol result indicating vitamin A deficiency is present. Okay. Of these, 72 would be incorrectly classified as having vitamin A deficiency. Of the 918 people with a result indicating that vitamin A deficiency is not present, 90 would be incorrectly classified as not having vitamin A deficiency. This is the best testing that they have. You want to go and take a radioactive isotope of retinol just so you can find out whether you might or might not have a phony vitamin deficiency? Okay, but let's go look at serum retinol, which is what's in the research. Serum retinol versus liver vitamin A. So they're literally comparing how much is in the liver versus serum retinol versus the blood retinol. So again, in 1,000 people where 100 have vitamin A deficiency, this is the fantasy world standard, measured with liver vitamin A. So they're saying they have vitamin A deficiency as measured literally with a biopsy in the liver. You have to be dead for that. Or they have to they don't do these studies on live people. So you're not going to get a liver biopsy. So they're saying they know they're deficient in the liver, but 206 people would have a serum retinol result indicating vitamin A deficiency is present. So that means they've doubled the number of people that they're diagnosing as deficient. Wow, are they overdiagnosing a phony deficiency? Of these, 153 would be incorrectly classified as having a vitamin A deficiency. Of the 794 people with the result indicating that vitamin A deficiency is not present, 47 would be incorrectly classified as not having vitamin A deficiency. Okay, so let's go back to retinol binding protein, which is another way they can measure vitamin A levels. They say that your RBP is equivalent to your serum retinol. It's not, but they say it. Okay, another thing, 100 people out of the 1,000 have vitamin A deficiency. Measured with retinol isotope dilution, 266 people would have a RBP result indicating vitamin A deficiency is present. That's even worse. So there's only 100 with vitamin A deficiency, and they're saying there's 266 that are deficient. This is what they're basing it based on the multiple studies, 8 studies, 16 studies, 23 studies. Of these, 216 would be incorrectly classified as having vitamin A deficiency. Vitamin A testing is garbage. That's why I'm going to show you all these studies where people have vitamin A deficiency and no symptoms. Do these things match up where the research, when they look at these studies honestly and they say, wait, they overdiagnose vitamin A deficiency, and then you look at the studies and you're like, wow, there's all these people with vitamin A deficiency who don't have studies. We're going to get into that. So let's go. Now we're going to get into vitamin A deficiency without any symptoms. Okay. First, let me open this one. This paper was from when? I think it was 19... They don't have the date of the paper on here. They don't have the date on it. You can tell this is an old paper. Okay. Title of the paper, Pathogenesis, Disease Creation Due to Vitamine. They're spelling it amine, vital amine, which is what they used to think, but almost none of the vitamins are amines. Anyway. The rats were fed on definite dietary planes, which would produce normal growth, except for the lack of either vitamin A or B. Okay, I'm going to give you a clue here. Do you know what mineral is definitely missing from a diet that can cause severe growth retardation? Zinc. So they're saying they're implying that they have enough zinc in this diet. Okay, there's enough zinc in this diet because they know it's going to cause normal growth. If they had a zinc deficient diet, which I'll show you, it would cause stunted growth. Okay, In the rats, which lacked vitamin A in their diet, there were no special outstanding pathological findings. So they know the diet's deficient in vitamin A. I'm telling you there's enough zinc. They found no problems in the rats. In marked contrast with the lack of vitamin B, so they gave some rats a vitamin B deficient diet. The no vitamin B diet, they saw, what they saw in the vitamin B deficient diet, they saw fatty changes in the liver, they saw the adrenals were hypertrophied, and the thymus was atrophied. Okay, but they didn't see any of that in the vitamin A deficiency diets. Okay, so let's keep going. We're always about the real world stuff. Okay. Now, what we're going to get into now is these mice studies where they genetically made them not produce transthyretin. Okay. Transport, TYHR, thyroid hormone, a T4, retin, it's got a retinol binding protein in it. So it's got a retinol binding protein, which holds retinol and thyroid hormone. And it's got a binding protein. I'm going to tell you, think about this. This binds up a retinol binding protein and a thyroid hormone. So is that thyroid hormone available? No, it's not. Thyroid hormone that's not available doesn't do thyroid stuff in your body. So does it make sense that if you had a bunch of vitamin A, which requires a bunch of retinol binding protein to protect you from it, and then your body makes a protein that not only binds those up, but it binds up thyroid, gosh, do you think that would make you hypothyroid by giving you less free thyroid hormone? Something to think about. Transthyretin is thought to play a major role in vitamin A metabolism and thyroid hormone transport in mammals. Now, retinol binding proteins to protect you from vitamin A, as you'll see. To invest the physiological role of TTR protein in the development of the embryo and the adult, we use gene targeting techniques to generate a null mutation at the mouse TTR locus. So they poison the mice in some way to change their genetics. The resultant mutant animals are phenotypically normal, viable, and fertile. They're totally normal. Wait, but what's their vitamin A levels at? However, levels of serum retinol, retinol binding protein, and thyroid hormone are significantly depressed in the mutant animals. They're not binding up all their thyroid hormone, and they seem fine. Interesting. Let me see. Was there anything else on this one? Nope. Let's go to the next TTR study. Okay. So this is the same type of mouse. Studies on the metabolism of retinol and retinol binding protein in transthyretin deficient mice produced by homologous recombination. In pooled plasma from the TTR without the TTR, that's the minus, TTR minus mice, retinol levels averaged 6% of those of wild type animals. So they are severely vitamin A deficient in their blood. And as you saw in the last study, nothing happened to them. Similarly, plasma retinol binding protein in the TTR minus mice was found to be 5% of wild type levels. Wow, those are very close numbers. Retinol binding protein, 5%, 6%. Hepatic retinol and retinol ester levels were similar for mutant and wild type mice, suggesting that the mutation affects neither the uptake nor storage of dietary retinol. Okay. There's no vitamin A floating around in the blood, but doesn't retinol binding protein transport vitamin A so the body can use it? Wouldn't they be falling apart? Let's keep going. One more study on these mice. Come on. Retinal anatomy, as in they literally named retinaldehyde retinal. They shorten it to retinal, and that's also the word for related to your retina. They're trying to confuse you and make you think when you think of retinol, you think of retina. Retinal anatomy and the function of the Transthyretin-null mouse. Remember, they have hardly any vitamin A in their blood. Which how would your liver get vitamin A to your eye? Through the blood. Vitamin A, retinol, is vital for the normal development and function of many tissues in the body, including the eye. Retinal morphology, as in the shape and the characteristics of the retina of the TTR null mouse, was normal. In addition, short and mid-long wavelength cone opsins were localized normally in both TTR null and wild-type retin-A. That's plural. Everybody talks about rhodopsin. It needs vitamin A. Consistent with these findings, TTR null mice show no anomalies of receptoral nor post-receptoral ERG components compared with wild-type mice. The results suggest that although circulating plasma levels of retinol and retinol-binding protein are extremely low, this reduction has little effect on the retinal structure or the function of the TTR null mouse. These data are consistent with the existence. This is where okay, I want to, before I say this, they're going to make up stuff now. They're going to be like, oh, it's just magically happening in ways that we haven't discovered yet. This is COPE. These data are consistent with the existence of mechanisms for the transport of retinol to the retina, independent of the classic retinol to retinol binding protein 2 transthyretin complex. We can't find the retinol in the blood, but somehow it's magically appearing in the eye, even though no one's figured out. When was this paper? 2001. I haven't heard of these magical pathways since. Oh, sorry. I'll zoom in so you guys can see it. I'll do this. You can pause it if you want to read this. Okay. No vitamin A, basically 5% of normal in the blood. No retinol binding protein, basically 6% of normal in the blood. And still the eyes are functioning absolutely normally. You want to know what they figured out over the years? Mice and rats need zinc, or else they get eye problems. So they started giving them zinc. And now in this paper, they can't reproduce the eye problems that are supposedly vitamin A. You're going to see this connection over and over and over again. So now we're into humans. Okay, so this is observed deficiency studies. So where they find people who are deficient and they look for symptoms. This is the most, like, they know people are not eating it or they're very low. They test them. And then they do or they don't have symptoms. Now, remember what I'm going to go over. So before you look at this and you're like, well, some of the people have vitamin A deficiency symptoms. Protein deficiency. I'm going to show you so many studies on protein deficiency causing vitamin A deficiency symptoms. I'm going to show you zinc deficiency causing vitamin A deficiency symptoms. I'm going to show you taurine deficiency causing vitamin A deficiency symptoms. So do you think any of these people could have had any of those other problems? I'm also going to show you that when your zinc intake goes down or your protein intake goes down, like in third world countries where they don't eat meat, which is where all the vitamin A deficiency studies are done, Africa, Bangladesh, India, whenever you can raise your vitamin A in the blood by eating zinc. You can raise your vitamin A in the blood by eating protein. But you're not eating vitamin A. But you get zinc and protein, and all of a sudden the problems go away that they say are vitamin A deficiency. So let's go into this one. So again, you're going to see some people having so-called vitamin A deficiency symptoms. But remember, there's all sorts of other things that can cause this. Vitamin A deficiency. Let me zoom. I know Joe's going to tell me to zoom in. Vitamin A deficiency experienced from a tertiary referral UK hospital, not just a low and middle income country issue. We're in the UK. Where didn't I highlight my thing? Of 628 requests for vitamin A levels from 2012 to 2016. 110 serum retinol concentrations were low or deficient in a total of 82 patients. As we just went over, those are going to be overdiagnosed. 62 patients were deficient by the World Health Organization criteria, whilst 48 were defined as having low serum retinol concentration. So they're close to the low cutoff. They're not there yet. There were a further 17 patients with a serum retinol concentration between 1 and 1.04 micromoles per liter who were not defined as abnormally low according to the laboratory assay utilized, and thus not in the current study. But I'm going to tell you, anything 0.7 and up is technically okay by their standards. But a range that could be considered as low. So see, they keep raising the low end. They're like, oh, the World Health Organization says it's here, but we're going to make a new category for like sort of low. And then we're going to add another category for, could be low too. This is not science anymore. CRP values were available for all but 8 of the low or deficient serum retinol concentration cases. Pay attention to this now. They're trying to say that they got all these low or sort of low people. The majority of patients, 80% of patients, did not report symptoms, and their hypovitaminosis was only diagnosed as part of the management of their chronic disease. Okay, so when you're trying to do science and you have a test and you're saying that everybody's low and nobody's coming up, 80% of people are not coming up with symptoms. Sketchy. Okay, so let's keep going. Here we go. Primary biliary cirrhosis, which we've helped someone fix. Dark adaptometry. This would be like night vision, electrooculography, and vitamin A state. 25 patients with primary biliary cirrhosis were studied for vitamin A state. In 9 patients found to have low circulating vitamin A concentrations, no abnormality was found on electrooculography or in dark adaptation. They got cirrhosis and vitamin A deficiency, and their eyes are fine. But what do they warn against? Patients with primary biliary cirrhosis should not receive regular parenteral as in injections or even oral vitamin A supplementation unless dark adaptometry or electrooculography yields an abnormal result. Why did they say that? Because vitamin A is literally toxic to the liver, and you already got people with cirrhosis, and they give them more vitamin A, and it's going to ruin their liver. Because vitamin A is an alcohol. Retinol is an alcohol. Same family as ethanol. Ethanol turns into acetaldehyde through the same detox pathway that turns retinol into retinaldehyde. Let's keep going. Vitamin A deficiency in Crohn's disease. So if we have Crohn's disease, that's going to be a bad absorption problem, right? I mean, this we help people fix this too. So weird that these diseases that come up where they say they're vitamin A deficiency, we put people on low vitamin A diet, and now we're doing the low nickel thing, and they get better. 52 patients with Crohn's disease, 31 outpatients and 21 inpatients. So that the outpatients, right, they're just coming in and visiting. They're not as bad. The inpatients, they're like hospitalized, right? They're staying at the hospital. They're worse. They were investigated for evidence of vitamin A deficiency. 11 of them, 21% of them had low plasma retinol concentrations. Okay. In contrast, of the 6 inpatients with low plasma retinol concentration, 5 had a level of less than 1 micromole. Its deficiency is not till 0.7, supposedly. And they weighed less than 80% of the ideal. These are undertypes. If you don't know my undertypes thing, it's generally underweight. And it also tends to mean they often have low blood tests. Undertypes are, this is not a judgment, undertypes are worse off. Underweight people are worse off than overweight people. It's just my observation. And that's in the research too, that underweight people literally die sooner than overweight people. So, 3 of them had impaired dark adaptation and a plasma retinol concentration of less than 0.8. Okay, so we got 3. Not all of them. Retinol binding proteins were not significantly lower. Okay. But I want you to pay attention to here. So these are people who are not digesting well. What do they say here? Vitamin supplements should be given and protein depletion corrected. What's in protein? Like muscle meat? Protein, calories, zinc, taurine. They literally know what the fix is. Let's keep going. But what I'm getting at is not everybody with vitamin A, their so-called vitamin A deficiency is showing the symptoms. It's a very big pattern. It's like way more than 50% already if you average these up. So what do we have here? Dietary vitamin A intake, coverage of vitamin A mega dose supplementation, and prevalence of vitamin A deficiency among marginalized children, poor kids, 6 to 59 months, so up to 5 years old, in Angawadis of Chandigarh. A multi-stage cluster sampling survey. So this is India, right? These are, okay, can you imagine marginalized kids in India? You think they're getting a lot of meat? None. So even though they say here, although 80% of children over 9 months reported receiving vitamin A supplementation. So not only are they eating, they're eating dietary intake of vitamin A rich foods. In the ones who get it, only 20% of them got it, but 80% of them said they're getting vitamin A supplementation. So there's okay, pay attention here. Only 20% of them are eating vitamin A rich foods and vegetables. And they're saying that basically only 38% had documented record of age appropriate complete supplementation. So how bad are they? Are they all falling apart because of vitamin A deficiency? None of the children showed ocular manifestations of vitamin A deficiency. None of them. For the subjects in which C-reactive protein levels were less than 5 milligrams per liter, 35% of them had serum retinol less than 0.7, and 2.3% of them had serum retinol less than 0.3. You know how hard it is to get people below, like 0.7 micromoles per liter? If you're doing the American units, is about a 20. Most people who come to me have vitamin A levels in the 40s, 50s. The really bad ones are up in the 60s, 70s. So a 0.7 is equivalent to a 20. 0.7 micromoles is equivalent to a 20 of, I think it's micrograms per deciliter. And they're saying 2% of them had serum retinol, so that would be below like an 8 in American units. None of them have eye problems. None of them. Let's keep going. Vitamin A status and nutritional intake of carotenoids of preschool children in, oh, let me make this bigger. I know Joe will ask me. Of preschool children in Ijayi Oriel community in Nigeria. Okay, so Nigeria, we have another potential population that is maybe not eating a lot of meat. Remember, all the vitamin A deficiency studies are always in low meat eating third world countries. That's where they are. Hold on, let me see what's going on here. I got to do Joe on Telegram now. Oh, Beth Martins was in Chandigarh. Thank you for commenting, Beth. That was where you got sick, right? You were probably being vegan in Chandigarh, doing lots of yoga and all that stuff. So, okay. We live and learn, right? Okay. This study was carried out to determine the vitamin A status and nutritional intake of carotenoids of 213 children between the ages of 6 months and 6 years in a rural community in Nigeria. So it's not a city. It's way out in the boonies. 109 males and 104 females, a total of 57 children. 27% of them were deficient in serum retinol levels, less than 10 micrograms per deciliter. That's That's what I'm talking. That's like less than 10. Normal deficiency is less than 20. While 102 had low levels, 10 to 19. So that's more like it. 20, below 20. So they're all these kids. So we have 100 and, oh no, we have 27 plus 48. That's 55. 75% of them are technically vitamin A deficient. 75% of them, 48% plus 27%. That's 75%. The highest prevalence of serum retinol deficiency was in the 6 to 12 months age group, most of whom were breastfeeding, and there was poor correlation between duration of breastfeeding and serum retinol levels. The prevalence of night blindness was 1.5%. 75% of the kids are vitamin A deficient, and 1.5% of them have night blindness. And none of them have xerophthalmia, which is the dry eye. Is vitamin A really science at this point? Wait, chronically malnourished children, lack of meat, had lower mean serum retinol levels than well-nourished children. They also had lower zinc levels and lower taurine and lower protein and probably lower calories. There was a high consumption of carotenoid-containing food, but despite this, there was a high prevalence of vitamin A deficiency. If they would have measured their livers, they would have found plenty of vitamin A in their livers. So let's keep going. Now we're into protein-calorie nutrition. So what I just went over, I was just showing you all the examples in the animal world, animal research, and in the human research, showing that vitamin A deficiency exists, but vitamin A deficiency symptoms do not necessarily exist in that same thing. Now I'm going to show you the other things that are well known in the research to cause what are called vitamin A deficiency symptoms in real people and real animals. What is protein-calorie nutrition? This is a combination of not enough protein and not enough calories. It's starvation and a lack of meat. Just think of it that way. It's a lack of meat. That's really what it is. So what does this do to, remember, we just talked about xerophthalmia. Let me get rid of some of my tabs here. Okay. Xerophthalmia, which is dry eye. This is supposedly one of the most classic symptoms of vitamin A deficiency. Dry eye then leads to keratoconus, which is the bump on your eye from your eyelid scraping your eye. Okay. Xerophthalmia and protein malnutrition in Bantu children. We're looking at South Africa. Okay. Previous report. So I can't highlight this, or can I? No. Xerophthalmia occurs not uncommonly in the Republic of South Africa. Not uncommonly. That means common. But wait, what changed? Previous reports of xerophthalmia in the Republic of South Africa are few, so something changed. Did they start supplementing vitamin A? Kark, or did they start eating less meat? Kark and Klennerman stated that xerophthalmia infrequently accompanies protein malnutrition. Wait, so it goes along with protein malnutrition, and eye symptoms, when present, seemed to be due to vitamin B deficiency, not vitamin A. Uman, McLaren, and Escapini did not mention the Republic of South Africa in their recent survey of xerophthalmia. Point 2, xerophthalmia is closely related to protein malnutrition. McLaren stated that the lone occurrence of either disease is the rule, and that these occur only in association only where they are both their worst. Uman, McLaren, and Scipini stated that protein malnutrition always accompanies the more severe manifestations of vitamin A deficiency. Protein malnutrition always, 100% of the time, accompanies the more severe manifestations of vitamin A deficiency. It's called COPE. Uman argued that xerophthalmia is a precursor, comes before protein malnutrition really hits, and considered that the eye signs are primarily related to vitamin A deficiency. Although he did state there are strong reasons to regard every degree of xerophthalmia as a case of general malnutrition. But vitamin A. But vitamin A. In any event, it is acknowledged that malnutrition may often be associated with xerophthalmia. The syndrome of discrete colliquative keratopathy, as described by Blumenthal in 1950, always occurs in association with protein malnutrition. Wait, another eye problem. Always in association with protein malnutrition. Okay, wait, again, you saw the cope in there. So let's keep going. So what about vitamin A and tear function, as in the cause of dry eye? 1991, the effect of diet on tear function is illustrated clearly by malnutrition-induced xerophthalmia. Dietary habits in well-nourished North American society, toxicity, have been implicated as a cause of some tear dysfunction. A review of the ocular literature suggests that sufficient dietary protein, and then they throw in vitamins A, B6, and C, potassium, we like potassium, and zinc. Wait, what comes from meat again? Dietary protein and zinc may be necessary for normal tear function. Oh, let's look at Americans then. Excesses of dietary fats, you people shoving just handfuls of fat in your cake hole. Salt, cholesterol, alcohol, protein, and sucrose have been associated with or suggested as causes of tear dysfunction. Okay. Nobody needs an excess of dietary fat. Nobody needs an excess of dietary salt. Nobody needs to eat cholesterol because your liver makes it. Nobody needs to drink alcohol. Can you eat too much protein? Yes, it can cause hyperammonemia. It can cause you to have too much ammonia, which causes all sorts of problems. And does anybody need to eat table sugar? No. Wait, what's the American diet? Oh, wait. So could Americans, even though they're eating plenty of meat, still get dry eye? Yes. Oh, what is one of the most common symptoms of pharmaceutical side effects? Dry eye. Wait, a toxin causing dry eye? That's weird. Okay, let's keep going. Plasma vitamin A, retinol binding protein, and prealbumin concentrations in protein-calorie malnutrition. Response to varying dietary treatments. Okay, so they saw that these things were low, and they gave them different dietary treatments. There's at least 2 other papers on this. Plasma vitamin A, retinol binding protein, and prealbumin concentrations have been studied in 38 northern Thai children with protein-calorie nutrition, another starving of meat group. The 4-week study period consisted of 1 week of stabilization. So they gave them enough protein and calories to get them stabilized, followed by 3 weeks of treatment with formula diets varying in their protein and calorie content. The stabilization period comprised 7 days of initial treatment with fluids, antibiotics, and a gradually increasing intake of protein and calories to a final level of 1 gram protein and 100 kilocalories per kilogram of body weight. So 1 gram of protein per kilogram of body weight. So they're at least getting close to half of their body weight in protein. Many of you out there, some of you ladies are not getting anywhere close to this. And you wonder why you're not getting better. I'm going to say it right now. Minimum. There will be people out there who will twist my words and say I'm saying that adults need only 50 grams of protein a day. I'm not saying that at all. And if you hear someone saying that I said that, they are dishonest. They are lying. They are trying to basically make me look bad because they probably already look bad. So 50 grams, 50 grams minimum protein for an adult. If you're an adult, this is like the World Health Organization minimum protein. The World Health Organization deals with starving people. Some of you ladies, especially, are not even eating 50 grams of protein a day. If you've never counted it up, that's like half a pound of meat a day. If you're just getting your protein from meat. That's the minimum. That's not a good amount. That's the minimum. Does everybody understand? Like, I don't know how to make this any more emphatic. If you're getting half of your body weight in protein a day, you're doing pretty good. Do I think people need to push the gram of protein per pound of body weight a day? I don't really think so. I don't do that. I seem to be doing all right, right? If you want to get more bang for your buck, here's the funny thing about a lot of these third world countries where they're not eating enough protein. You want to know what they eat a lot of on their food? MSG. MSG is the cheapest protein powder booster that you're ever going to come across. That's why they don't all die of protein malnutrition, because they're all using MSG out there. And MSG takes any protein you're eating and makes it more effective. I've shown that in the MSG episode. Okay, so they bumped up their protein, they gave them antibiotics, and they gave them fluids. During this period, so I want you to see, they gave them antibiotics, they gave them fluids, and they gave them more food, more calories. They didn't say they gave them more vitamin A, did they? During this period, vitamin A went up, retinol binding protein went up, and prealbumin levels all showed significant increases compared to admission values, whereas plasma albumin and total protein did not change. What I'm telling you is that, I mean, they gave them protein, they gave them calories, they gave them water, they gave them antibiotics. They didn't say they gave them more vitamin A. They didn't supplement them vitamin A, and they watched their vitamin A levels go up. If they gave them more protein, did they probably give them more zinc? Yeah. These studies demonstrate that plasma retinol binding protein and prealbumin concentrations are more rapidly responsive and sensitive to dietary protein intake than is plasma albumin concentration. Furthermore, the absence of a 24-hour rise in plasma retinol binding protein after parenteral, that's either they tube fed them or they gave them injections, after parenteral vitamin A provides further evidence that hepatic retinol binding protein synthesis is impaired in protein-calorie malnutrition. Retinol binding protein. What do you need to make proteins? What do you need to make proteins? You need amino acids or protein. What does retinol binding protein do? It protects you from vitamin A. If your body doesn't want vitamin A running around in the blood and it can't make retinol binding protein to go in the blood to protect you, what will it do? It will hold the vitamin A in the liver. So what do we see in tests? We see low vitamin A in the blood, and there's tons of vitamin A stuck in the liver. Is there a vitamin A deficiency going on? No. That's what we just saw in those other studies. So, protein-calorie malnutrition. Let's keep going. I'm gonna hit on this hard because this is just, a lot of you folks are not eating enough protein, even though you still think, I eat meat every day. If you've never totaled up your protein grams in a day, you need to. Relative significance. Oh, sorry, Joe. Let me get in there. Relative significance of protein-calorie malnutrition and vitamin A and carotene level in the etiology, the cause of xerophthalmia, dry eye in Indian children. Again, not going to be a lot of meat eating. And there's going to be tons of curcumin and vitamin A and all that stuff. Clinical entity of xerophthalmia has been recognized since ancient times by the Egyptians, and it was attributed to inadequate diet. With the time, various teams of workers observed that vitamin A and protein-calorie nutrition played a significant role in the clinical manifestation of xerophthalmia. It was also stressed that it is not only the deficiency of vitamin A alone But an additional factor of protein-calorie malnutrition is essential to cause xerophthalmia. You must, just like they said in another paper, there must be protein-calorie malnutrition to cause xerophthalmia. Do you understand what they just said there? You could have vitamin A deficiency and not have xerophthalmia. The only way you can get xerophthalmia is if you have supposedly vitamin A deficiency and protein-calorie malnutrition. But didn't they just show that fixing protein-calorie malnutrition raised vitamin A in the blood, even though they didn't eat any more vitamin A? Do you understand that the vitamin A part of this is all BS? Your eyes need protein. Okay, protein energy malnutrition, vitamin A deficiency, and night blindness in Bangladeshi children. You see where they go for these studies? Why aren't they doing it in America? Our results showed that night blindness was associated with protein energy malnutrition when using the mid-upper arm circumference. So they measured around the bicep. They're basically measuring the bicep as a measure of nutritional status. So they said when the kids are obviously starving, that's when night blindness hits. Oh, wait, again, it wasn't vitamin A deficiency. This may indicate that night blindness is only one aspect of the general protein energy malnutrition problems in this population. Okay, they're just starving. It's not that they don't get enough vitamin A foods. They're literally starving and their eyes are falling apart. One of the things that I did not like that happened in the low vitamin A community as a whole, some people trying to go as low as possible probably really stunk on their protein intake because they started going, beef has too much vitamin A. And I'm like, I never said that. Nobody who's doing a good job in this area ever said that you shouldn't eat meat because it's got some vitamin A in it. People were like, oh my gosh, grass-fed beef, it has too much vitamin A. I'm like, you've lost the whole point. You've lost the story. You're going to have a rough time. Nobody in my world ever said that. Are there some people in my world who are eating way too much protein? Yeah. Like when I hear people eating beef 3 times a day and then they're like, gosh, my ferritin's high, doc. Why is that? And I'm like, what'd you think was going to happen? You're shoving iron in your cake hole 3 times a day, the most absorbable form of iron that you could take. Maybe eat less red meat. I never said to eat red meat 3 times a day. I never said to go vegan. We're trying to find somewhere in between. Some people are going to eat chicken and turkey more than they eat red meat, and they do better that way. Okay? If you got high ferritin and you're shoving red meat in your cake hole 3 times a day, and you got high ferritin, you might want to reconsider that. But nobody's saying that you shouldn't eat muscle meat because it's got some vitamin A in it. Don't want you to get protein malnutrition now, do we? Okay, let's go into this one. I remember very early on in the low vitamin A days, we were hearing about people who were trying to go as absolutely low as possible on vitamin A. And they were literally making their diet centered around like white flour, white sugar, refined coconut oil, and I don't even know what else. They were eating a completely refined powder type diet. And they didn't feel good. No-ish. Really? You're eating a stupid diet and you feel bad? So again, I've never been one to say that vitamin A was all the problems. Now we're on the nickel thing and we got the copper thing and we got the manganese thing and we got all these things that we are working on. We were never just all about vitamin A. And I even allowed people to have some butter at the start because I was like, if you're going to quit the program because you can't even have a little bit of butter, I'd rather you had a little bit of butter and stayed on the program. We're not going to cut off our nose to spite our face. Yeah, I'm a little fired up right now because lots of people in the low vitamin A community have done unwise things because they're either trying to be maxers or they're trying to be minimizers, and they're not using their brains. They just think more is better, whether it's more as less or more as more. Don't do that. The role of retinol binding protein in protein-calorie malnutrition. So retinol binding protein is what your body uses to protect you from retinol. Retinol stored in the liver. Your body will hide retinol in the liver as much as it can from your system if you cannot make retinol binding protein, which requires protein to make it, and zinc. So here we go. Plasma retinol binding protein is decreased to 1.62 milligram plus or minus this, or 30% of normal in the acute stage of kwashiorkor. That is protein energy malnutrition. That's like true starvation. What happens when you eat some more food? Retinol binding protein doubles its plasma level after 1 week and triples after 2 weeks of appropriate refeeding. In the research, they say you can test serum retinol or you can test serum retinol binding protein, and they're basically going to give you about the same answer in terms of vitamin A deficiency. Why would retinol binding protein go up just from eating more protein unless you needed it to protect you? Okay. Come on. Use of serum retinol binding protein for prediction of vitamin A deficiency. It predicts protein deficiency is what it does. Effects of HIV-1 infection, protein malnutrition in the acute phase response. The relation between RBP and retinol was examined in a cross-sectional study of 600 Kenyan, right? We're back in Africa, women. Like retinol, RBP may not accurately identify true vitamin A status under all conditions. Wait, so both of those tests suck? Because the acute phase response and protein malnutrition depress retinol binding protein concentrations. Is it a vitamin A deficiency or is it just protein deficiency? Oh, now we're going to get into a fun one. Cystic fibrosis. Because, right, cystic fibrosis, they'll say, oh, cystic fibrosis people need to take lots of fat-soluble vitamins. You got to take fat-soluble vitamin D, and you got to take fat-soluble vitamin A, and you got to take fat-soluble vitamin E. You got to take vitamin K. You got to take all this stuff because you can't absorb fat. Okay? Let's get into it. We're going to hit on some things that this will just, intelligent adults with children will understand this very quickly. And those of you who can think back to when you were a teenager. Vitamin A deficiency and nocturnal vision in teenagers with cystic fibrosis. Teenagers. Do you think protein intake could be a problem with teenagers? Do teenagers like to rebel? Maybe parents telling them you got to eat enough protein. They might say, piss off. I'm not going to eat protein. I'll eat what I want. I'll eat Lucky Charms all day. I'll eat bread. I'll eat rice. I'll eat, they'll be vegan because the animals, right? Teenagers are just something else generally. My teenagers are good. Maybe it's because I keep them sane with a good diet. I don't know. Okay. Plasma retinol. Alpha carotene and beta carotene levels were below the lower limit of normal in all but one patient. 5 out of 10 patients, they had a normal eye exam. But they may have also presented a poor or a pathological dark adaptation test. Did they test their protein? Did they test their zinc? And then I want you to pay attention here. They say these 2 patients showed a dramatic increase in nocturnal vision after 1 year of adapted retinol supplementation. It doesn't take 1 year to fix this. Okay, now if you listen to Matt Stone, right, he says he can go like a month or 2 with eating a super low vitamin A diet. And it fixes his asthma. But then he starts to get the night vision stuff that he gets. Or was it, it was like bright, bright light problems and night vision, stuff like that. And he eats one meal of high vitamin A and it fixes it for like a month. One meal. I'm telling you, vitamin A does stuff. Have I said for a long time, and Matt knows this, have I said that I think Matt has a zinc deficiency and he's had a long time zinc deficiency? Yeah. Has he fixed it yet? He hasn't chosen to, at least he hasn't told me. Okay. I hope he does. I mean, Matt's situation is the most exciting in all of, except for, okay, wait, Joe, if you want to find Megan Stevens, her, is it gerbil or hamster experiment where she's put them on a low vitamin A diet and they're fine. She's got it on YouTube. So if you can, Joe, you put it up before, if you can find that, that would be great. And then we have Matt Stone, who went on a super low vitamin A diet. And yes, he does eat a meal every month to get his vitamin A levels up and his eyesight gets better. Okay. But again, what if he got more protein and he got more zinc to raise his vitamin A levels and fix his eyes? Those of you who are familiar with Matt Stone's history, he does not eat like a health nut. He knows, if you watched my video with him, I did a video with him on the channel. Matt is a friend of mine. We wrote a book together. Okay. We literally wrote a book together. Matt is a buddy of mine, but he's also, I'm going to use him as an example here. He knows I'm just going to be blunt here because, Matt knows this. Matt eats like shit. Okay. Like he's eating like sugary cereals and stuff that are low in vitamin A. I love the guy. I wish he wasn't doing it, but he's doing it. And we got to see the end of the experiment. He started getting eye problems. And now that we know this, and his daughter has a nickel allergy. And he started looking at my stuff about nickel and he started going, dude, I'm eating a lot of chocolate. Oh, you got Megan on the screen? So yeah, Megan Stevens, there it is. The one with the gerbil, I think it was a year. Oh, Joe, you misspelled Stevens. But anyway, so she's got that video there. My gerbils just passed 1 year with 0 vitamin A. You want to know what she made sure those gerbils got was zinc and enough protein. And wait, they've lived a year without vitamin A. Megan's a big fan. I mean, I talked to Megan on, we have a group chat with Kelsey and Megan and somebody, I won't say, and Wardy on Telegram. And we talk and we work on things there. So Megan is a huge asset to the Love Your Liver community. She always has been. Wardy is too. And this is one of the biggest contributions that Megan's doing for the community. Matt Stone is literally, even though it may seem like I'm kind of dogging on him a little bit, I'm not. I'm saying Matt Stone's situation is like a huge opportunity for the low vitamin A community to prove that it's zinc. And we know now that nickel slows down vitamin A detox. So anyway, love you, Matt, dude. You're my bud. But a lot, I had to get on the Matt Stone thing because the haters are just jumping on it because they refuse to understand any of this. I could hit them over the head with all of this and they'll never listen. So wait, let's go back to the vitamin A with cystic fibrosis. Conclusion: low vitamin A levels occur frequently in clinically stable, eutrophic, and retinol supplemented cystic fibrosis adolescents. So they're clinically stable, retinol supplemented. Wait, they're still getting dark adaptation. Why would that be a vitamin A deficiency then? Hey, what if we found protein malnutrition causing night blindness in cystic fibrosis people? Would that be crazy? You know what I'm going to do next. Protein energy malnutrition as the first manifestation of cystic fibrosis in infancy. The protein energy malnutrition that is characterized by hypoproteinemia, edema, that also happens when you have a low protein diet, you get swelling, and anemia. Wait, let's just review. So this goes for the mother who might be nursing and the eventual baby who turns into an infant, who turns into a kid, who then eats meat. Anemia contains what two things that are critical for, three things that are critical for preventing anemia: protein, iron, and zinc. Has been reported in 5 to 13% of the infants with cystic fibrosis. Due to the surprising higher incidence of protein energy malnutrition as the first presenting manifestation of cystic fibrosis in Macedonia. Do we have anything else on this? Nope. Let's just hit on this one. Protein energy malnutrition is a common manifestation of cystic fibrosis in infancy. Teenagers not eating enough protein, getting eye problems, taking, you know what? And here I want to go back to the this whole thing. So I was talking about, they showed a dramatic increase in nocturnal vision after 1 year of adapted retinol supplementation. 1 year. Matt Stone fixes his in 1 day. So do you think it took a year? Or do you think maybe these two teenagers put their thinking cap on and stopped being dumb teenagers and started eating better, like more protein? Over a year, they finally figured it out. Honey, maybe your eyes will get better if you just eat some frickin' meat. Oh, okay, Mom, I'll try it. Whatever, I'll try it. And then they do. Oh, it only took a year to fix you. No, it only took a year for them to mature enough to actually do what was correct. Okay. Now we're going to get into zinc deficiency. So remember, protein deficiency, zinc deficiency, taurine deficiency, these would all come about because a lack of meat. Meat. Okay. So first, actually, let me get rid of some of these tabs. Zinc and its deficiency diseases. So let's just make sure here. So the biggest thing that they talk about with vitamin A deficiency, they talk about dry eye and they talk about night blindness. Okay. We love zinc. Let's go over some of the deficiency diseases associated with zinc. The pervasive, that means it's everywhere. Role of zinc in the metabolic function of the body results from its function as a cofactor of a multitude of enzymes. Zinc is found in every tissue in the body, and because zinc metalloenzymes are found in every known class of enzymes, the metal has a function in every conceivable type of biochemical pathway. Vitamin A doesn't have that. Symptoms resulting from zinc deficiency are as diverse as the enzymes with which the metal is associated. If chronic, severe, and untreated zinc deficiency can be fatal. Never heard of anybody dying from vitamin A deficiency. They could die of starvation. Less drastic symptoms include infections, hypogonadism. Ladies and men, if you have hormone problems, you probably need some zinc. Weight loss, undertypes, emotional disturbance, dermatitis, skin stuff, alopecia, losing hair, impaired taste acuity. That's the losing your sense of smell and sense of taste that they talked about with the coof. What's this one? What is this one? Wait. Zinc deficiency causes night blindness? That's crazy. Poor appetite, delayed wound healing, and elevated blood ammonia levels. Many symptoms of zinc deficiency result from poor diet consumption. But often the most severe symptoms result from other factors, including excessive alcohol use. It depletes your ADH. Liver diseases, malabsorption syndromes, renal disease, enteral or parenteral alimentation, that's tube feeding or IVs or injections, administration of sulfhydryl containing drugs. Sulfur inhibits detox. We say that over and over. Drugs depleting zinc. Zinc is needed for detox, so they would compete. And sickle cell disease. The most severe symptoms of zinc deficiency occur in young children affected with the autosomal recessive trait acrodermatitis enteropathica. This disease results in a decreased synthesis of picolinic acid. Hey, is that what's in zinc picolinate? And picolinic acid can also be made from nicotinic acid, flush niacin, which causes an impaired ability to utilize zinc from a common food. Because simple laboratory analyses are often not reliable in determining zinc nutriture of a patient, they're good enough. But wait, what do? We get zinc on hair testing and blood testing. Most places only ever do it once, one of those. These symptoms caused by suspected zinc deficiency are best verified by the oral administration of zinc dipicolinate, which is just zinc picolinate. Don't go looking for zinc dipicolinate. You won't find it. This zinc compound is efficacious and safe and would provide an accurate means of identifying symptoms that do result from zinc deficiency. Wait, so they're saying, in their opinion, zinc testing isn't adequate. It's not good enough. So how do we really know if it's a zinc deficiency? You give zinc. You correct the deficiency. Wait, so what were they doing on those protein malnutrition and vitamin A studies? They started giving them food and protein, and they saw the problems go away. But then they'll still be like, but it's vitamin A deficiency. But it only happens if there's protein malnutrition. But it's vitamin A deficiency. This is nonsense. All of this vitamin A stuff is nonsense. Oh, Bitose spots. Yes, let's go over this one. Bitots. I'm just going to call it Bitot spots because it rhymes. Vitamin A status of children in 5 Ecuadorian provinces. So Bitot spots are supposedly what they call pathognomonic. Means that if you find Bitot spots, you've pretty much found vitamin A deficiency. That's what they're going to say. Of the 1,232 survey children whose serum retinol levels were measured, 18% and 2% were found to have levels below 0.7. That's deficient. So that's 18% were below 0.7 and 0.35. So that's like 10. So this is 0.7 is 20 in the American units and 0.35 would be 10. So 20% of them were below 20 and 2% of them were below 10. Low serum retinol levels were more common among children of mothers who had relatively little education and resided in rural areas. Not to be mean, but they were poor and uneducated. So are they probably going to be able to buy a lot of food? No. The presence of Bitot spots was confirmed in 2 of the study's children. 2 kids. 1,200 kids. 20% of those were low in vitamin A. 20% of this is what? 246. 246 kids were vitamin A deficient. 2 of them had Bitot spots. Okay. Cool. Does zinc deficiency cause Bitot spots? You know what's coming. (2025) Zinc deficiency, a spot diagnosis. A man in his 70s presented with a white conjunctival lesion in his left eye, which had grown in 8 months. The patient complained about soreness and grittiness. You know what grittiness is complained about by people? What the situation that they have in their eye that they complain about grittiness? Oh, that would be dry eye. The lesion was removed. They took it out in another clinic, but it had grown back after a few weeks. The foamy plaque was easily dislodged with a cotton bud. Histology, where they look at it under a microscope, showed extensive keratinization with incorporated bacteria. Wait, you know what allows bacteria to grow and suppresses your immune system? Zinc deficiency. Confirming the suspected diagnosis of a Bitot spot, the lesion once again returned within a week. Cut, burn, or drug. This is what conventional medicine does. They're cutting. That's what they're doing. So, soreness and grittiness. Oh, this must be vitamin A. He's got dry eye and he's got a Bitot spot. Wait until you see the cope. The most common cause of Bitot spots is vitamin A deficiency, because of course we got to say that. This was excluded as vitamin A serum levels were found to be normal. Serum zinc, however, was decreased 0.51 milligrams per liter. So he was at about a 51. So those of you who know, I want zinc levels on a serum. Well, I know plasma is a little different. Anyway, I want plasma zinc above 100. This is low. This is significantly low. Not the lowest I've seen. 2 weeks after oral zinc supplementation, zinc sulfate 200 milligrams 3 times a day. This is like 50 milligrams 3 times a day. So I think they were given this. So 200 milligrams is the total zinc sulfate. I think 50 milligrams of that 200 is actual elemental zinc. So he took 150 or something. Well, actually, let me just do this. Let me do how much elemental zinc is in 200 milligrams of zinc sulfate. Let's see. Yeah, there it is. I was about right. 46 milligrams of elemental zinc, 23%. Okay, so he was taking 3 times this. So we'll just call it 50, just for easy math. Okay. So 2 weeks, not a year. It doesn't take a year to build up a fat-soluble vitamin like in that cystic fibrosis study. Okay, serum zinc increased. It doubled after 2 weeks. Oh, sorry, I'm showing the wrong one. There you go, Joe. I got it. Thank you. I ordered a second monitor so I can talk to Joe and do all this and see the chat. And because that's what I need. My second monitor, I don't have one because I got a whole new computer set up. Second monitor was my Telegram and my YouTube chat. So I can't see the chat right now and I can't see my Telegram. So I got my phone here that keeps turning off. You know, it goes back to sleep and whatever. And anyway, we'll get there. So he doubled his zinc in 2 weeks of 150 milligrams a day. Ish. And the lesion and accompanying ocular surface symptoms disappeared completely after 6 weeks. No primary cause of the zinc deficiency could be found by an internist. I'm going to guess he's an old guy and maybe didn't have a lot of money, or maybe he decided to go vegan and he just wasn't eating enough protein. And you know what people do with their practitioners? They lie. Oh, yeah, I'm eating meat every day, because they don't want to look like they're dumb, or they just don't want to tell the truth. This is literally in the literature. People blatantly lie to their practitioner. I'm not totally against that. If somebody's, you're playing a game with your doctor. Sometimes they don't want to order any tests that are useful. And so you might have to tell them, people might do this. People might tell them that they have a problem, that a symptom that they might not actually have, to get a test done. I don't know anyone who would do that. I don't know anyone who would suggest doing that. It's just something that could happen. So 2 weeks, fix the problem. 2 weeks. Disappeared completely. Now, what do we know from the research? If this gentleman actually had vitamin A deficiency and he took enough zinc, what would happen to his vitamin A levels? They would go up. Did he take vitamin A to fix this? No, but is it known that when you get enough zinc that your vitamin A levels in your blood go up? Yes. So what do unknowing researchers think happened? Oh, you fixed your vitamin A. That's what fixed your eye. No, it was the zinc. Always was. Oh, let's see the cope. Let's do the cope. Here we go. So remember, this is the wrapping up of the case study. So they got to apologize to the Rockefeller Science Research Journal gods. They got to say, well, we found something that doesn't match. So we're gonna bow down and we're gonna say vitamin A is everything, and zinc did this. Okay. A Bitot spot is a textbook clinical sign that is traditionally associated with vitamin A deficiency. In this case, however, it was related to an isolated zinc deficiency. Zinc is a trace element that is needed in the hepatic liver synthesis of retinol binding protein, which mobilizes retinol from the liver. Oh, wait, what is, oh my gosh, sorry. That wasn't supposed to happen. Let's go back. Okay. Zinc deficiency can therefore lead to lower bioavailability of vitamin A. You remember the studies on the mice where they showed that they had almost no retinol in their blood and they still didn't get eye problems and they had almost no retinol binding protein? Why can the researchers not read these things and like put them together? So of course it wasn't the zinc that fixed it. It was that it made vitamin A available. Other mechanisms have been proposed as well to explain why they think it's vitamin A that does this and not zinc. That's what they mean. There is little recent research on the synergistic effects between vitamin A and zinc. It's not a synergistic effect, it's a zinc deficiency. And it causes more vitamin A to show up in the blood out of the liver. One study suggests that vitamin A deficiency in children is managed best by supplementing both vitamin A and zinc instead of vitamin A alone. This would be like, oh, you got to give them enough protein and you give them vitamin A, and then it fixes the problem, even though you could have fixed it with just the protein or you could have fixed it with just the zinc. Our patient, however, solely had a zinc deficiency, which responded promptly to zinc supplementation. The lack of a clear cause for zinc deficiency in this patient is a limitation of this case report. Causes of zinc deficiency include decreased intake, such as a vegetarian diet, malabsorption, gastrointestinal disorders such as Crohn's disease, cirrhosis, and sickle cell disease. Maybe the guy was an alcoholic. Do people hide being an alcoholic from their doctor? Yeah. Is zinc deficiency a well-known symptom of alcoholism? Yes. Patient's perspective. This was a very necessary part of this paper. I was bummed out. 80-year-old guy saying this. I was bummed out that the white lump on my eye kept coming back every time an ophthalmologist removed it. After the zinc tablets, it disappeared completely. But I probably still have a vitamin A deficiency, or I don't know what. It's just so stupid. Okay. Wait, does zinc impact tear function? We already kind of went over that. Oh, this was one we already went over. Yep. Don't need this one. Sorry. Let's go back here. Let me go and delete this one from this one. We already got that one. Okay. Yes. Let's connect all of these to zinc. Let's do this. This is a fun one. So, you know, when I said you can pretty much trace every single symptom that they associate with vitamin A deficiency to zinc deficiency or protein deficiency, but especially zinc deficiency? Iron status in rats fed on diets containing marginal amounts of vitamin A. Severe vitamin A deficiency in rats is known to cause anemia. Okay, so track these. Anemia associated with growth retardation and impaired water retention. They say water retention. Are these? Yeah, these are not necessarily Merkin, like native English speakers, maybe. Because they talk about water intake and they're saying impaired water retention. Like you're not trying to, when we talk here in Merca, we don't want water retention, right? You don't want to be dehydrated, but you don't want to retain water because that's swelling, okay? And you'll see they'll talk about water intake later. However, study of the effect of marginal vitamin A intake is of more interest because such intake may mirror the situation in humans in many developing countries. So they have to make an excuse. They're going to say, we're looking for these problems of marginal vitamin A deficiency because we're obsessed with vitamin A, because the World Health Organization and Bill Gates and all of them love vitamin A and they need to push it on us more. So they got to look and say, well, your diet's just sort of low, so we got to get you on supplements because supplements help the infertility psyop. Therefore, in 2 experiments, the effect of marginal vitamin A deficiency on iron status was investigated in male rats. They almost always do males after 28 days of feeding either low or high vitamin A diets. Body weight and feed intake were not influenced by the level of vitamin A in the diet. Liver weight was lowered by vitamin A deficiency. Do we have a problem with excessively large livers these days, like called fatty liver? Wait. Let me show you this. Fatty liver. Let's go look at what fatty liver looks like. Okay, so just look around. So, right, that's a normal liver right there. Maroonish. Buildup of fat in the liver is this. Here, well, let me make it a little bigger. Let me get in. Oh no, come on, forget it. I'm going back. I'm not. But see, they start showing steatosis. It's yellow and fatty. And they start showing these livers, and they start getting, instead of reddish, they get yellowish, and they get more yellowish and more nasty. Fatty liver here is yellow. Fatty liver here is yellow. Fatty liver here is yellow. Okay, so these livers are getting larger. They're literally adding fat to them. And what color is vitamin A? What color is vitamin A? Generally, it's yellow or orangish, or it can be red in terms of lycopene. But when we're talking about retinol and retinol palmitate, it's yellow. So just remember, fatty liver is yellow. Vitamin A is a fat storable alcohol that they bind to to store retinol in your liver, you have to bind it to a fatty acid ester. Wait, so if you had too much retinol bound to fatty acid esters and they were yellow, the liver would make more fat to store them, and the color of that fat would be yellow. This is not very hard to put together. So we have that. Okay, let me finish this, going over this. Water intake was not influenced in rats on a low vitamin A diet. So was the water causing the impaired water retention or low water intake, whatever they're trying to say? No. Plasma retinol concentrations were decreased in rats fed on diets low in vitamin A. Whoa, crazy, right? Okay, so now let's go back to it. Let me go back to my list. Hey, can a zinc deficiency cause anemia? Wait, what's this paper? Association of zinc with anemia? Zinc is an essential trace element, and anemia is the most common blood disorder. The association of zinc with anemia may be divided into three major forms. Number one, zinc deficiency contributing to anemia. What's in meat again? Iron and zinc. Oh, wait. In most cases, zinc deficiency coexists with iron deficiency. What's in meat again? Especially in pregnant women who need more food and preschool-age children who are literally growing almost as fast as they're ever going to grow in their life. So they got to make more blood. It seems that zinc deficiency alone does not result in anemia, and that it may need to cooperate with other factors to lead to anemia. Protein, calories, zinc, iron, taurine, meat. I'm going to tell you guys, nearly all of the vitamin deficiencies out there, including the B vitamins, they're almost all going to be found in people who are not eating enough meat. Scurvy is a meat deficiency. Beriberi is a meat deficiency. Wait. So let's see. Can a zinc deficiency cause growth retardation, right? We had anemia, growth retardation, and then water intake, water retention stuff. Hey, wait. Zinc nutrition and growth retardation. Human growth retardation from zinc deficiency was first reported over 40 years ago, but they don't talk about it anymore. More recently, marginal zinc deficiency, a little bit of zinc deficiency, was shown to occur during pregnancy and infancy. Wait, wasn't that when they were saying the anemia was happening? Pregnancy and infancy? And to be prevalent in children throughout the world who are not eating meat. Zinc with or without macronutrients and other micronutrient deficits may also occur in patients with GI disease. Remember the Crohn's study we went over? Particular attention must be given to the suboptimal intake of zinc, which results in growth retardation. Notice they didn't say no zinc. They said suboptimal. The single most important cause of nutritional growth retardation worldwide is poverty-related malnutrition involving multiple macro and micronutrient deficits. The nutrition problems in the world are meat deficiencies. And no, I'm not an all-muscle meat carnivore person. And still, a lot of people are not eating enough meat, even in the US. Okay, so now let's go into... We're going to hit on this one. Edema, swelling, hypoproteinemia, not enough protein in the blood, and zinc deficiency in low birth weight infants. Oh, would that be generally something stunted their growth? They're not as big as they should be. 3 premature infants with zinc deficiency who had an unusual presentation with generalized edema. They were just swollen all over, and low protein in their blood between 5 and 9 weeks of age are described. The infants were fed their own mother's milk, supplemented with a proprietary formula, some trash, soy, seed oil, garbage made by a corporation after the first 2 or 3 weeks of life. None of the infants had diarrhea, liver disease, or urinary protein loss. Treatment with oral zinc supplements led to rapid resolution of the edema with an increase in values for serum proteins, but they didn't have them eat more protein. Alkaline phosphatase, if you ever have low alkaline phosphatase, like below a 70, it's a marker of zinc deficiency. Low phosphorus on a hair test is a marker of zinc deficiency. Alkaline phosphatase, phosphorus, you hear it in there. Low alkaline phosphatase is another marker of zinc deficiency. Low hair phosphorus is also a marker of zinc deficiency. And we can fix both of them with, imagine this, what am I about to say? Zinc. Oh, and their zinc went up too. Shocking. Pay attention to when you fix this deep zinc deficiency. At 1 year follow-up, all infants were doing well and had normal growth and development. As zinc plays a critical role in nucleic acid and protein synthesis, it is postulated that dietary zinc deficiency in the phase of rapid postnatal growth, after they came out and they're growing as fast as they're ever going to grow, precipitated edema and hypoproteinemia in these infants. They didn't get enough probably nursing, and they probably didn't, whatever was in those stupid formulas ruined them. Zinc deficiency should be included in the list of causes for generalized edema in the low birth weight infant. But it fixed their blood protein too. Did you notice that? Oh, what about the water? What about the water? Oops, wait, what did I just do? What about the water problem in those mice? Transport of electrolytes, water, and glucose in zinc deficiency. So remember, we had anemia, we had stunted growth or growth retardation, and we had a water problem. Zinc deficiency in humans and animals results in failure to thrive, stunted growth, skin lesions, loss of hair, and diarrhea. I take my zinc every day. Have you noticed? The results indicate that net water and sodium transport from the small and large intestine of zinc-deficient rats was significantly decreased compared to corresponding mean values for pair-fed controls and ad libitum-fed rats. That means the rats got to eat as much as they wanted. Wait, so it fixed their water problems. Wait, zinc fixed edema in the little babies. Zinc fixed the water transport in these rats. But they're going to try to say, we're going to go back to this. Iron status in rats fed on diets containing marginal amounts of vitamin A. So they're trying to find a vitamin A problem. And they found a zinc problem. They're so insistent on looking there, though. Okay, let's do this one. Villi height. Let's go into zinc deficiency and villi height. Those are those little teeny tiny fingers in your gut that absorb your food. And brush border enzymes are enzymes in that brush border, the villi, like, you know how they call it a brush, like these little fingers, brush border enzymes. So let's see what we can find here. What are they going to blame on vitamin A deficiency next? That's really a zinc problem. That's what we're going to do next. Vitamin A deficient rats have only mild changes in jejunal structure and function. This study, oh wait, let me make it bigger. I know Joe's going to say that. Make it bigger. The study investigated the effects of clinical and subclinical vitamin A deficiency on intestinal structure and function in rats. Weanling male rats fed a vitamin A deficient diet for 40 to 42 or 60 to 63 days were compared with rats either pair-fed or with free access to the same diet, that's ad libitum, supplemented with vitamin A. A reference group was fed a standard rat diet. Weight began to plateau in vitamin A deficient rats after 42 days. It took them 6 weeks for vitamin A deficiency to cause a problem. You know what that sounds like? You know what I think they do in a lot of these animal studies when they try to make it vitamin A free? They're literally making it a zinc deficient diet and a taurine deficient diet, both of which would cause vitamin A toxicity to get worse, and they cause their own problems. So weight began to plateau after 6 weeks, becoming significantly different from pair-fed rats at 60 to 63 days. So it took 9 weeks to become significantly different. Diarrhea did not develop. Vitamin A deficient rats had clinical signs of vitamin A deficiency in the 60 to 63 day study, but not in the 40 to 42 day study. However, serum and liver retinol concentrations were negligible in all vitamin A deficient rats. So wait, you're telling me there was no real vitamin A in the blood of these rats, and there was no real vitamin A in their liver. How were they? I mean, they were born, right? They were born. And how did they develop normally for 6 weeks with zero vitamin A in their system? Do you understand what they're saying there? They literally had no vitamin A in them the whole time. They were born. The mom probably got vitamin A. Kids were born. They literally had no measurable vitamin A in their liver or in their blood. Yet they were fine for 6 weeks. And they only got a problem at 9 weeks. But they were vitamin A deficient the whole time. No differences from the other rats were detected in the 40 to 42 day study for any variable measured. Because clinical vitamin A deficiency in rats, like serious vitamin A deficiency, causes only mild changes in intestinal structure and function, it is unlikely that these alterations alone are responsible for the interactions observed in epidemiological studies, as in lots of people that they're looking at, studies between vitamin A deficiency and diarrheal disease. So they're saying that vitamin A deficiency is not causing all these diarrheal diseases that they say it does in third world countries where they don't eat enough meat. So let me just hit on this, right? The vitamin A deficient rats in the 60 to 63 day study had significantly reduced villi height, the fingers, and sucrase and maltase activities compared with pair-fed rats. Okay, so they're saying that it took forever for this problem to show up. It took 9 weeks for the supposed vitamin A problem to show up, and it only really showed up in the villi and sucrase and maltase. You know what these are called? These are called brush border enzymes. Okay? What do you think I'm going to go find? Zinc in gut-brain interaction in autism and neurological disorders. Let's go. Zinc levels mediate villus height. That means they control the height of the villi. They control it, not vitamin A. Zinc controls the villi height. And the villus to the crypt ratio in the jejunum. That's another marker there. Zinc deficiency results in a shortening and narrowing of the villi, and thus a reduction in absorptive surface. So remember in that study with the kids where they gave them zinc and then they were fine a year later? So zinc can last a long time. So that might also mean that zinc deficiency can take a long time to show up, like in these rats. They had vitamin A deficiency the whole time, but the zinc deficiency got worse and worse. Wait, but what about those sucrase and maltase, those brush border enzymes? Additionally, several alterations in the activities of brush border enzymes result from zinc deficiency. I mean, sometimes I really do think I got the right name as the nutrition detective. I remember when Tyler Ginter, and I forget who else I was talking to, and they were like, well, what are you going to call yourself? And I think I came up with nutrition detective. I think I did, but if I didn't, then I would want to give credit. I don't remember. But anyway, this is like, I hope if you're a researcher out there and you're looking at this, I mean, I hope you don't feel offended enough that you don't look into this further, because like I gave you an entire research paper or multiple to fix this, to you can become famous in the research world by writing this stuff up. AI won't write it up because AI will be like, no, vitamin A is one of the most foundational vitamins and nutrient interactions in all of literature. And I'm like, that maybe we should create a new word. A-idiot, like as in AI idiot. A-idiot. Serious. Vitamin A metabolism during the repletion of zinc deficient rats. So wait, they're going to give rats zinc and they're going to watch what happens to vitamin A. They're not giving them vitamin A, though. The experiments reported here were designed to determine if low plasma vitamin A levels observed in zinc-deficient rats are reversible, as well as to examine the time required for any response. In experiment 1, rats previously zinc-deficient were repleted for 6 days with a zinc-sufficient diet, fed either ad libitum, that means they were matched up with others, or ad libitum was they got as much as they wanted, or pair-fed the amount consumed by a zinc-deficient group. After repletion, plasma vitamin A concentration for the zinc-sufficient group returned to within normal range, while the pair-fed group had a plasma vitamin A concentration intermediate between the zinc-sufficient ad libitum, they got enough zinc and they got to eat as much as they wanted, and zinc-deficient groups. The zinc-sufficient ad libitum group had a lower concentration, they mean in the blood, I believe, but higher total liver content of vitamin A in the other two groups. So they were never vitamin A deficient. In experiment 2, the response of zinc deficient rats to intraperitoneal zinc repletion, so they're injecting them with zinc, was examined daily for 7 days. There was a 3-day lag period before plasma vitamin A began to increase significantly following zinc treatment. They didn't give them vitamin A. They had it in them the whole time. By the 5th day, plasma vitamin A concentration increased to within the normal range. Oh, pay attention here. The data suggests that adequate food intake as well as zinc appears necessary, as in essential, to totally reverse low plasma vitamin A concentrations in zinc deficiency. Possible mechanisms are discussed. Protein-calorie malnutrition as well as zinc appears necessary to totally reverse low plasma vitamin A concentrations in zinc deficiency. And zinc deficiency itself will make blood vitamin A look low. Was it ever a vitamin A problem? Okay. Let's keep going. Let's see how zinc deficiency interferes with retinol binding protein production, which is how your body protects itself against vitamin A in the blood and the liver. Okay. Well, actually, this didn't. Oh, yeah, here it is. Expand. There we go. Wait. Zinc deficient rats have very low plasma vitamin A levels in spite of adequate liver vitamin A stores. But remember that other study where there was plenty of vitamin A in the liver in the rats that didn't make retinol binding protein, and there was hardly any retinol in the blood and hardly any retinol binding protein, and they still didn't have visual problems. Oh, I want to zoom. Okay, got it. Okay, moreover, the liver retinol binding protein levels of the zinc deficient group were only about 55 to 60% of the levels of either the ad libitum, as much as they wanted, or pair-fed control animals. The data suggests that zinc deficiency interferes with the synthesis or the creation of retinol binding protein by the liver, and probably with the synthesis of other plasma proteins as well. The low plasma vitamin A levels seen in zinc deficiency can be attributed to an impaired ability of the deficient rat to mobilize vitamin A from its liver in the form of the retinol to RBP complex. The first thing you should ever think if you see zinc deficiency, I mean, if you ever see vitamin A deficiency in the blood, is you should think zinc deficiency, unless you're one of my people who are on a low vitamin A diet and you literally earn over years a low vitamin A level in the blood. You earned that by not eating it. If somebody eats plenty of vitamin A, like one of the sickest people who came into me, she came into me and she was like, she had a vitamin A level of 17, right? So 20 was deficient. She was drinking milk all the time. She ate a crap diet that was full of vitamin A. And I was like, there's no way you're vitamin A deficient. And she was really, really sick. I don't think her and her parents could handle what I talked to them about. So I never saw her again. But she was an undertype. Wow, low vitamin A and an undertype. Eating plenty of vitamin A. It was all stuck in her liver. And we'll just hit on this again. Zinc deficiency reduces hepatic liver cellular retinol binding protein in rats. So now that means your liver can't protect itself against vitamin A. Don't think of retinol binding protein as like it's the little escort to help vitamin A go to where it's needed. No. It's literally made especially by your fat. Wait, do you know that your fat makes most of your retinol binding protein, your body fat? Can we store vitamin A in fat? Yes. So I want you to think about this. Instead of thinking the liver's making the retinol binding protein, I don't know that these scientists, imagine this. What if these scientists cannot determine where the retinol binding protein was made? Whether it was made in the body fat or whether it was made in the liver. So if the retinol, let's say you start getting zinc and your body says we can start detoxing vitamin A again. We have a ton of it stored out in the body fat. How are we going to get that vitamin A from the body fat to the liver? Oh, we need to make retinol binding protein so we can bind it up and protect ourselves from it and then send it from the body fat to the liver. Can scientists tell which direction the vitamin A is going? Can they tell whether it's going to the liver or back from the liver? No. Can they tell where the retinol binding protein was made? No. But they assume, as in they make an ass out of you and me with their bad assumptions, their bad assumptions. Okay? Hepatic cellular retinol binding protein levels were measured. The experimental group received a zinc deficient liquid diet ad libitum, as much as they wanted of a zinc deficient diet. Liver cellular retinol binding protein was reduced by more than 50% in the experimental group as compared to each of the three control groups. So again, retinol binding protein is made by the fat. It's made by the liver. But if you don't get enough zinc, you don't make it. So that means you're not going to be detoxing vitamin A very well because what do you need zinc for? You need zinc to run alcohol dehydrogenase. That is exactly how you get retinol and ethanol into the aldehydes, the retinaldehyde and the acetaldehyde. And then you have ALDH, which is even more important than most people's ALDH sucks. But if you don't have enough zinc, you don't run ADH. And it all stays stuck in your liver. Okay, so let's keep going. Oh, wait, but what does this is good old Anthony Mawson. No, I'm sorry. This is no, it's not Anthony Mawson. But there's a quote in this paper. Now, I couldn't get the whole paper. Can't find it. But we have this one page from the website that published it. And I have a quote from this paper. So I'm going to show it on my references sheet. Here is the quote from that paper. We only can see the first page that I showed you. Hypervitaminosis A, as in vitamin A toxicity, occurs when plasma retinol exceeds the availability of retinol binding protein to bind it, leading to elevated levels of free retinol. They're literally saying vitamin A toxicity happens when there's not enough retinol binding protein to protect you from all the retinol And then you have free retinol. So you'd have retinol binding protein retinol, and you'd have free retinol. And the free retinol is what causes you all your problems. But that's in that paper. So why don't we get into taurine now? Now, you guys may have seen my short about how taurine. I'm gonna go over taurine real quick because if those of you go out and you start supplementing a bunch of taurine, I didn't say to do that. I've talked about how my mom fixed her eye problem with taurine, and now she doesn't need taurine anymore. I talk about taurine and its duration paradox, where it helps things short term by helping your bile recipe and maybe protecting you from a bit of your vitamin A toxicity, but over time, it will cause problems if you keep taking the supplement. So if you feel better on taurine at the start, you need to know that that's going to end at some point if you're doing a low vitamin A diet. The benefits of the taurine are going to end at some point, and then they're going to cause you problems. Taurine can be helpful at the start, though. And where do we get taurine? Don't believe the internet that you can get taurine from dairy or eggs. You don't really get much taurine at all from those, if any. You get it from muscle meat. Okay? Taurine is necessary for proper retinal development and function. Gosh, more eye stuff. Taurine, evidence of physiological function in the retina. It is a sulfonic amino acid. It's not a normal amino acid. It's what's called a sulfonic. Yes, it does have sulfur in it. Hey, maybe that's why it becomes a problem if you take too much of it for too long. We do need taurine. We do need some. We do need to eat muscle meat. Supplementing it over the long, it could help in the short term, but over the long term, it will cause problems. I'm going to say this over and over so people are not running out getting on taurine. If you want to try it, try it. If it helps you, you can use it. If you need to know that at some point the help is going to go away and it's going to make you worse. I literally showed that in one of my shorts. The research, they specifically said short term it helped with like fear and other stuff, and then chronically low dose long term it made them more fearful, and it made their pain sensitivity go up. They were more sensitive to pain. Do you want that? No. They literally showed the duration paradox in mice with taurine. I tell people taurine has a duration paradox. It can help in the beginning and it'll cause problems later. Am I saying to stop eating muscle meat? No. Please use your brain here. Listen to what I'm saying. Taurine is a free amino acid. Well, it's a sulfonic amino acid found in high millimolar concentrations in mammalian tissue and is particularly abundant in the retina. Mammals synthesize taurine endogenously. Wait. We make taurine in our body with varying abilities, with some species more dependent on dietary sources of taurine than others. Cats are very dependent on taurine from their diet. Human children appear to be more dependent on dietary taurine than adults. Maybe that's why those little kids were getting problems, pregnancy, and little kids were getting problems from not enough meat more than everybody else. Specifically, it has been established that visual dysfunction in both human and animal subjects results from taurine deficiency. Visual dysfunction. What do they say visual dysfunction is? First of all, it's vitamin A deficiency. Moreover, the deficiency is reversed with simple nutritional supplementation with taurine. Wait, is that like giving people protein and giving them zinc? Same thing? Wait, what if we just gave them taurine too by giving them meat? What do they, with the quotes around them, what do they want us to eat less of? Meat. Eat a plant-based diet and eat the bugs. That's what we want you to do. No. Eat meat. The data suggests that taurine is an important neurochemical factor in the visual system. However, the exact function or functions of taurine in the retina are still unresolved despite continuing scientific study. Even though they know that if it's not there, it causes problems, they don't know the functions or the mechanisms exactly. What do you need to know all the functions or mechanisms, or do you just know you need to eat muscle meat? Nevertheless, the importance of taurine in the retina is implied in the following experimental findings. 1, taurine exhibits significant effects on biochemical systems in vitro cell studies. The distribution of taurine is tightly regulated in different retinal cell types through the development of the retina. 3, taurine depletion results in significant retinal lesions. That's the one you need to know. 4, taurine release and uptake has been found to employ distinct regulatory mechanisms in the retina. Wow, it sounds pretty important to the retina. Oh, let me go get rid of some tabs so I don't slow down my computer so much. Okay. The Biology of Taurine. This is a book. Okay, this is a long book. They used to have it on Google Books, which was where I was going. But like I told you guys, link rot on the internet, like links just disappear. Or all of a sudden, Google Books doesn't give me access to these pages anymore. So I give you these guys these links, and I'm trying to give you in these reference docs, I'm trying to give you the title of it so you can go search for it on your own if the link is dead. So don't be a lazy ass. If you want to find a reference and I give you the name of the study, go out and look up the name of the study. If the link doesn't work, don't be lazy and be like, it doesn't work anymore. That's why I gave you the name of it. People in link rot, like I give you the name of the study so you can go look it up. It is not, I cannot keep up with, imagine me trying to keep up with all the links I've ever put out there. And people are like, this link is dead. Will you go find it? No, you go find it and give it to me. I'm trying to advance like the whole medical paradigm here. I don't have time to find a link for you. So we're going to hit on some basic things here. In 1975, that's a good year. It was first demonstrated that taurine deprivation produced retinal degeneration in cats. This is that whole Price-Pottinger study. All the Price-Pottinger study showed was that cats need taurine. That's all it showed. It wasn't about cooked food or any of that stuff. It was about literal taurine not being in their diets. They were on like just dairy. And you remember how I told you there's no significant taurine in dairy? That's what the Price-Pottinger studies showed. More recent studies showed that a taurine-free diet or the administration of taurine transport inhibitors caused retinal degeneration in other mammals. Yes, that's misspelled. We do not know whether human infants fed taurine-poor formulas show the same abnormalities observed in our infant monkeys. So they starved monkeys of taurine, and they got retinal degeneration too. Why do we study monkeys? What's the idea behind that? Because they're close enough to us. They're similar enough to us that we can assume things from that. However, the two species, as in, I believe they're saying humans and monkeys, are closely similar in nutritional requirements. Retinal structure and visual abilities and their plasma taurine levels are similarly affected by dietary taurine depletion. So they're not going to do this to human kids is what they're saying. They're not going to deprive human kids of taurine and cause them eye problems. Therefore, serious consideration must be given to the possibility that similar changes occur in formula-fed human infants which have no taurine in them and have gone undetected because they produce no grossly observable symptoms. It's just the eye that's degenerating. Indeed, human infants might be more vulnerable because the retina and brain are less developed at birth than in rhesus monkeys. Although major manufacturers have begun to supplement their infant formulas with taurine, a number of smaller companies, at least in the United States, have not, and no requirement for taurine has been established. The purpose of a system is what it does. Are they trying to help people or make people suffer? Let's go to the next part of this one. More species. Rats depleted of taurine by treatment with guanidinoethane sulfate, GES, were protected from retinal degeneration when kept in the dark. So no light coming in, and their retinas didn't degenerate. Okay, they gave them this stuff, whatever that is. On the other hand, rats with dietary taurine deficiency were not protected by light deprivation. How many of you out there are listening to this and you're sensitive to light outside? That's a vitamin A toxicity symptom. What does taurine help protect you from? Vitamin A toxicity. Oh, we'll get to that paper. Furthermore, oral taurine administration did not protect rats from the damaging effects of continuous illumination. So it didn't make their eyes invincible. Okay? And GES-treated rats showed no increased vulnerability to continuous light. The hypothesis, the idea that taurine protects the retina from light-induced damage, is also inconsistent with our finding that cone photoreceptors. What do they talk about vitamin A helping with? The photoreceptors. Rather than the more light-sensitive rods are more affected by taurine deprivation. Thus, retinal degeneration in taurine-deprived animals probably cannot be attributed to increased sensitivity to the damaging effects of light alone, but may result from increased vulnerability to a variety of other destabilizing influences on membrane structure. Oh, I don't know, like protein deficiency, zinc deficiency, calorie deficiency, taurine deficiency, all these things that are found in meat. Okay. So now I'm going to hit on these really quick. I'm not going to read through all of these. I'm just going to show you because they already went over this in this paper. Okay. I'm just going to hit on the titles of these. Retinal degeneration associated with taurine deficiency in the cat. Okay. Retinal degeneration induced by taurine deficiency in light-deprived cats. Retinal degeneration associated with taurine deficiency in the cat. Is that the same one? Oh, that was the same one. Sorry. Okay, so we know the cats need taurine. Let's go through the monkey studies. Abnormal visual acuity, that's in you can't see clearly, and retinal morphology in rhesus monkeys fed a taurine-free diet during the first 3 postnatal months. Okay. Retinal degeneration in 3-month-old rhesus monkey infants fed a taurine-free human infant formula. Long-term effects on retina of rhesus monkeys fed taurine-free human infant formula. Think of the damage that's happening to the kids who are being born to like vegan moms. Visual acuity loss in the rhesus monkey infants fed a taurine-free human infant formula. Is that a repeat? No. Sorry. And dietary taurine is essential for normal retinal development in monkeys. Essential, necessary, required. Oh, but vitamin A. Oh, taurine and dry eye. Wow, that's a weird connection. Antioxidant and osmoprotecting, as in fluid movement activity of taurine in dry eye models. The purpose of this, so they're going to do topical here. To assess the protective effects of ophthalmic formulations based on taurine and sodium hyaluronate, that's hyaluronic acid for those of you who want to know, on the ocular surface. So they induced dry eye. Dry eye was induced by atropine sulfate, and then they gave these different formulations. Some of them had taurine in them, some of them didn't. All the altered parameters, as in the dry eye they caused, were significantly reversed by 0.5% taurine and 0.4% hyaluronic acid treatment. Furthermore, this formulation was more effective than the hyaluronic acid alone. Moreover, tear levels of MMP9 were significantly lower in the group treated with 0.5% taurine plus 0.4% hyaluronic acid. Notice they didn't mention just the hyaluronic acid thing again. So The taurine containing one did the best. Although altogether, these data suggest that taurine has a relative antioxidant effect in corneal epithelial cells and prevents the ocular surface damage elicited by the dry eye caused by atropine. Remember, dry eye is a big vitamin A deficiency symptom. Okay, so now let's hit on this one. Zinc and taurine protect cells from retinoic acid damage and injury. Wait, zinc and taurine are both found together in what food? Oh, meat. Effect of taurine on the toxicity of vitamin A in rats. A study, let me make it bigger. A study was undertaken to investigate the effect of taurine on the toxicity of vitamin A in male Wistar rats. The rats were divided into 6 groups and fed different diets with or without supplements of 5% taurine and 25 to 50,000 units of vitamin A for 2 months. That's a rat. Okay, like supplements of vitamin A for people are like 25. If you just get a vitamin A supplement by itself, it might be 25,000. For an adult human, it was found that the body weight of rats, the ratio of liver and kidney weight to body weight, and the level of glutathione in the liver were decreased with increasing the dose of vitamin A. So the rats didn't gain weight properly. The liver to kidney weight ratio was off, and the level of glutathione, they had less glutathione. Wait, nickel makes less glutathione. Nickel also in animals, it decreases their body weight, but the human studies show that it makes humans fatter. Wait, vitamin A makes humans fatter. I've shown that research. Why do nickel and vitamin A have the same patterns? Could it be because nickel inhibits the detox of vitamin A, which I've shown in another live stream? Yeah. The levels of vitamin A in the liver and kidney, the levels of thiobarbituric acid reactive substances, TBARs in the plasma and liver, and the activities of AST, a liver enzyme, and ALT, the other liver enzyme, and levels of blood urea nitrogen and creatinine in the plasma of rats were increased with the increasing dose of vitamin A. What does this mean? Oh, wait, vitamin A gets stored in the liver and kidneys? Wait, vitamin A, toxic vitamin A gets stored in the liver and kidneys, and it makes fatty liver that's yellow. And you have influencers out there saying that vitamin A doesn't accumulate in the liver or kidneys, and they lie to your face. Liver enzymes went up with vitamin A. Creatinine went up with vitamin A. That's a marker of kidney damage. Hence, symptoms of vitamin A toxicity in rats included loss of body weight, liver toxicity, and kidney toxicity. However, these toxic effects of vitamin A were significantly reduced when the rats were fed the diet with the supplement of taurine. Furthermore, the level of vitamin A in the serum of rats treated with taurine and vitamin A was higher than that of rats treated with vitamin A alone. Wait, so taurine raised the vitamin A level in the blood, just like protein did, just like zinc did. And it relieved the symptoms of vitamin A toxicity. This indicated that taurine might play a role in reducing the toxic effect of vitamin A in rats. You guys seen a pattern here? What if the whole all muscle meat carnivore diet showed most of its quick and early health benefits by simply reducing the amount of vitamin A that people were eating, reducing the amount of copper they're eating, and greatly increasing the amount of zinc that they're eating, and they're definitely getting enough protein and taurine. So, am I advocating an all muscle meat carnivore diet? No, absolutely not. Muscle meat is critical to fixing vitamin A toxicity and to fixing nickel toxicity, but you do need carbs. To detox. So, hope this is all making sense. Okay, so we did that. Then we go, oh, wait. So that was retinoic acid. So this was, this was just vitamin A in general. Now we're going to go to this one. Protective effect of taurine, zinc, and tocopherol on retinol-induced damage in human lymphoblastoid cells. So they're talking about immune system cells, right? You can say whatever you want about vitamin E. You don't need it. You don't need to avoid it in foods, but you don't want to try to get more of it. Simple as that. And vitamin E has been shown to be protective against vitamin A toxicity. You don't need to take vitamin E. You just need to take less vitamin A. Okay. Cultured human lymphoblastoid cells exposed for short times to retinol and retinoic acid. So they're exposed to vitamin A. It's a cell study. Undergo a time and dose-dependent decrease in viability. That means they're not living. Accompanied by cell swelling. So the longer they're exposed to retinol or retinoic acid, the more they die. The higher the dose of retinol or retinoic acid, the more they die. Viability means like legit cells that they could function. The presence of taurine at 5 to 20 micromoles and zinc, 50 to 100 micromoles, protected cells from retinol-induced injury. No, it's because the zinc and the taurine are raising the vitamin A in the blood that's why it helps. No, they're protecting you from it. Taurine 20 micromoles and zinc 100 micromoles added simultaneously abolished, destroyed completely cell swelling and increased cell viability from 7 to 55%. Increased the cell viability by 8 times. Meat. Okay, now let's do... Oh, wait, did I already do this one? Yeah, I did that one. Where's the skin health one? Oh my gosh. Hold on. I think I'm missing my taurine and skin health one. Let me find it real quick. So again, they like to say that skin problems come about because of vitamin A deficiency. There it is. Let me put this in the document before I forget. And then I'll show it to you. Okay, there it is now. So we got this. Let's do this. Taurine, 2-aminoethane sulfonic acid. Useful in skin diseases because it protects you against vitamin A toxicity. And what do we help fix a lot by getting people off vitamin A? Oh, their eczema, their psoriasis, their keratosis pilaris. So taurine's useful in it, and taurine helps protect against vitamin A toxicity. Wow, let's read this. Taurine, or 2-aminoethane sulfonic acid, occurs naturally in food, especially in seafood or meat. Especially in meat. Don't eat seafood. Full of mercury, microplastics, forever chemicals, glyphosate. There's enough glyphosate in the oceans that it's eating away at the coral reefs, folks. Don't eat stuff from the ocean. Taurine is used in topical anti-acne therapy. When was this paper? 2012. It was used to explore anti-tumor promoting activity in a skin carcinogenesis study. It is used in skin ulcers. Due to its antioxidant and anti-apoptotic properties, it exerts an anti-wrinkle effect on the skin. Taurine at 0.05 to 0.15 gram a day is effective in treating the underlying causes of psoriasis, vitamin A toxicity. It is also used in atopic eczema, vitamin A toxicity. Nickel makes all of those worse. Wait, did they mention vitamin A being necessary in any of this? Nope. Okay, I know this seems long and dry. I need to put this out there. This is consider today. I'm doing this one for me, and I hope you guys benefit, and I hope you send this to people who like to argue that vitamin A is a necessary nutrient and that it's not slowly eating away at them. So let's go into this. We're going into vitamin A depletion diets in humans where they've literally taken away vitamin A. Now, remember I said most of the time when they make vitamin A deficient diets, they're zinc deficient. And zinc deficiency can cause they're going to be taurine deficient often. Sometimes they're going to be muscle meat deficient. So when you see some of the people in these studies get some issues, just like some of the rats got problems and some of the mice got problems, but not all of them, it's not a vitamin A problem. The diet has a problem. So if you design a proper vitamin A depletion diet, you don't have problems. But there's people out there, Murphy's Law says that some people out there are going to design terrible diets for themselves that are low in vitamin A and they're low in other stuff, and then they're going to blame the low vitamin A. No, it wasn't that. It was that they made a bad diet. User error is rampant. User error is always rampant. Never forget that. When you see, it's like when you see on Amazon or eBay, you see 3,000 good reviews, and then you see 3 terrible reviews, and the people are like, this doesn't work, and I pushed the button and it didn't. Those people are usually mouth breathing. They couldn't fight their way out of a paper box using any kind of sense. User error. Okay? Like the people who put diesel in their gas tank, and then they tell the gas station, you broke my car. No, you did the wrong thing. Okay? And if you're not sure what to do and you need help, that's what the Love Your Liver program is for. And you can ask other people who are already doing it. Now, I may have to read from some of this because I couldn't highlight it. Vitamin A deficiency and the requirements of human adults. We're looking at 1945. Oh, this is summarizing the JAMA, or the New England Journal of Medicine, I believe. 23 conscientious objectors, right? Because we're going to try to do a study on them that might hurt them if they're not going to war for us. If you're not going to become cannon fodder, you can stay here and we'll do something that we think could hurt you, but it didn't. 20 men and 3 women volunteered to live on a diet designed to be deficient in these substances, but complete in every other respect. The absence of vitamin A and its precursors was confirmed spectrophotometrically and biologically. So they're putting them on an extremely low, or trying to make a 0 vitamin A diet. Remember how I told you if you try to go too low, you're going to create a nutritionally deficient diet that will cause other problems? Young rats fed on the diet grew well when supplied with vitamin A, but without it failed to thrive, and their livers at autopsy were devoid of vitamin A. I'm telling you, just like Matt Stone's diet, if you try to go too low in vitamin A, as the researchers have said, since back then, they said you can't do this, you're going to cause other nutrient deficiencies, okay? The disappearance of keratin from the blood plasma of the deprived volunteers confirmed the absence of these substances from the diet. I'll tell you, we've done the testing on beta carotene, and it confirms what the researchers show. The very first thing to go down is beta carotene. And until your beta carotene is really low, your serum retinol won't come down, because if you got beta carotene coming in too much, that just splits up into 2 retinaldehydes, turns into retinol, and then you got serum retinol going on. The carotene must come down first. If I had somebody who, they literally came to me with orange skin and high beta carotene, their serum retinol did not start going down until their orange skin was gone. I'm telling you, you got to get the carotene down before things start moving. Okay. Prophylactic and therapeutic tests were made with vitamin A and keratin, and fecal excretion tests were made with keratin from different sources. No attempt was made to differentiate between the biological values of different isomers of keratin. Let's just look at this. So they were like, oh, the mice died. The mice died. Whatever. With efficiency for dark adaptation, as in night blindness, and plasma values for vitamin A as criteria, none of the 16 deprived subjects became depleted within a year. Do you know how much of this poison you're storing in your liver and your body fat? If you have a year's worth of it in a normal person in 1945. People are eating more vitamin A than they've ever eaten now. You have years worth of this. So why would anybody assume, like the Weston A. Price knuckleheads, that everybody's got a vitamin A deficiency and everybody needs more? 11 of these 16 subjects, 11 of the 16 subjects continued the test for more than 13 months. And only 3 of those showed marked signs of depletion after 14, 17, and 22 months, respectively. They only started to come down. I call this the plateau, when people stay very steady for a long time, because I've seen enough serum retinol tests to actually make them useful, unlike most of these researchers. Most of the remainder showed no changes attributable to vitamin A deficiency. Nobody's showing vitamin A deficiency symptoms, but that's a lot different than them saying it killed the mice, right? Except a gradual fall in the plasma value for vitamin A. One person failed to show this sign of deterioration of the vitamin A levels even after 22 months. The state of the vitamin A reserves of this sample of the population of Great Britain in the summer of 1942 would thus seem to have been sufficient to meet the requirements for from 1 to 2 years. So none of them had any dark vision problems after a year of what they're saying is pretty much a zero vitamin A diet. Okay. Let's keep going. Oh, epilepsy. We have helped people with their epilepsy. I have a whole episode on seizures and epilepsy, and I have a testimonial about a child who is now seizure-free after using our approaches. So here was the paper, Vitamin A and Epilepsy, a Dietary Contretemps. Contretemps? I don't know how to say it. It's French. Was this it? I need to find the actual paper. I thought I got it. Let me see. Was this it? Oh, wait. Let me see. Hold on. I don't have that paper. I got to find it. This is an important one. Or is it here? It might be this one. Hold on. Just got to search for one word. Contretemps, or whatever it is. There it is. Here we are. Okay, so let me go and get rid of this one. There we go. And let me move this one up to where it is supposed to go. And there we go. Okay. Let me get back up to the top so I can cover all this. The experimental induction of vitamin A deficiency in humans. Which, again, if they design a shitty diet, there's going to be problems. Guaranteed. Oh, I thought this was funny. These seasonal changes are reminiscent of the observations of Block, referred to above, reporting that all children in the children's home consuming the fat-free milk diet came down with xerophthalmia during March, April, and May. Of course, these months differ from those in the Sheffield experiment. Perhaps xerophthalmia follows a seasonal decline of plasma vitamin A in winter by a few months. Fat-free milk diet. Who's eating that? That would be a... Wait, that sounds like the Price Pottinger diet that they gave the cats. Pasteurized milk. Fat-free. We do need some amount of fat, folks. Some amount. It's not what people think out there. But a fat-free milk diet would be high in casein, which has vitamin A in it. Casein literally has vitamin A in it. So does whey. Milk proteins literally have vitamin A in them. I'm not going over that research today, but it's out there. You can look it up. Fat-free. Does milk have enough taurine in it? No. Does milk have enough zinc in it? No. Are they really trying to like nutritionally support kids in a children's home? It's probably like an orphanage. Do they really care about them? I mean, I'm saying, should they? Yes. But do they really treat them well? No. They're doing experiments on them, literally. Okay. Pay attention to this. This might remind you of Matt Stone. A case of self-induced vitamin A deficiency, it's not that, was reported in 1969 by Sharman, a 20-year-old man who had been suffering from epilepsy from age 12, became convinced from reading the literature that vitamin A caused his epileptic fits. He deliberately eliminated all vitamin A and carotenoids from his diet. His blood retinol dropped to 130 IUs per liter. Normally, a blood vitamin A would be about 2,000 IUs per liter, and the blood carotenoid level became extremely low. Well, that doesn't matter one bit. Subsisting on this diet for 4 years resulted in corneal xerosis, that's dry eye and scratching of the eye by the eyelid, and severe retinal damage. Okay, so remember Matt said his asthma and I believe his skin was much better when he was on a super, super duper low vitamin A diet. But then he would develop the night blindness and I think the sun sensitivity. And he had to eat some vitamin A to fix it. Okay? So he's fixing an issue for a long time, but then he developed another issue. Remember how I talked about zinc deficiency taking a long time to show up? Or if you fix zinc deficiency, it takes a long time to go away. What happened to this gentleman? He reported that his epilepsy was much ameliorated. He had suffered only one fit during 4 years. Upon repletion with vitamin A, he recovered his ocular health. I've told you this before, that you can somehow bridge the zinc deficiency gap with vitamin A. I don't know how it works. I just know that that's what's going on. No information is available regarding his epilepsy subsequently. In order to investigate further a possible connection between vitamin A and epilepsy, Sharman then studied 8 epileptic patients giving a vitamin A depleted, not zero, depleted diet for 2 years. 0, as in no cases of night blindness were observed. When their plasma retinol had reached 230 IUs per liter, right? They say normal is about 2,000. We're getting scared you're going to get vitamin A depleted. They were given a vitamin A supplement. Although the patients reported fewer fits during the depletion period, they were fixing their epilepsy. There was no increase in the fits during repletion because if you fix a problem long enough, it's going to take you longer to build up the problem again. Vitamin A builds up in you. So if you depleted enough, for those of you who have done the low vitamin A diet and you fix your stuff and then you go, oh, hey, I'm just going to go eat like a normal person now. Could you slowly build up your vitamin A again and have the same problems come back, or even new problems, different problems? Sure. The author called his experiment a dietary contretemps or whatever. Okay, what he's saying is that something unexpected is happening. We didn't expect this. He was embarrassed that it worked. A comparison of the human experiments involving induction of vitamin A deficiency. The daily allowances of vitamin A recommended by Bucher, Wagner, Hume, and Krebs, and Soberlich on the basis of their experience was roughly in the same range and similar to the current recommended allowance. However, differences were observed by the different investigators in the response of their subjects to the developing vitamin A deficiency. Maybe it's because some of them used better diets and some of them used worse diets. And they're just, again, they're grouping it all into vitamin A deficiency. If you ate literally white sugar only, that's an extremely low vitamin A diet. Will you cause problems with that? Yeah, of course you will. What if you ate only refined coconut oil? Yeah, it's low vitamin A. You're going to cause problems. here's the obvious difference. A striking difference between the experiment of human Krebs and that of Wagner was the severe, almost simultaneous weight loss of all 10 volunteers in the Wagner study after only 3.5 months of continuing the deficient diet. Gosh, do you think maybe they didn't give them enough protein or zinc or calories? And no weight loss in the former study. Wait, so one study had no weight loss and another one had severe simultaneous weight loss. Oh, does this mean they changed their diet all of a sudden? Everybody's going along fine. And then they're like, wait, this is going too well. We have to make this look bad. Let's change their diet drastically and everybody starts losing weight. Could never happen. So Wagner, furthermore, severe impairment of dark adaptation in all 10 subjects was observed by Wagner after 5 months. So wait, as people are losing weight drastically after 5 months, after 3.5 months, they started drastically losing weight. A month and a half later, they all get night blindness. In the study of human Krebs, only 3 of the 17 subjects showed significant deterioration of dark adaptation after 1.5 to 2 years. What could be the explanation for these extreme discrepancies? Human Krebs note in a, quote, personal communication received from Wagner after the war that Wagner's subjects had been, quote, under detention in an institute, perhaps meaning institution, where they had been receiving a diet nearly devoid of vitamin A for periods of up to 2 years before beginning the experiment. Even though Wagner, 1940, in his report explicitly states that all his subjects had freely consented, free willing to be subjects and that they had been in a, quote, well-nourished state. Wait, this is a setup. This is a setup. They were supposedly eating an almost vitamin A-free diet for 2 years already, and they were well-nourished. 3.5 months into the study, all 10 of them start drastically losing weight, severely losing weight, and in 5 months, they've all got night blindness. This is BS. This is absolutely, they just started starving them, or they took away their meat. That's probably what they did. Liars. In this light, the experiment of Bucher et al. Should be mentioned. These authors observed a deterioration of dark adaptation among all 5 subjects who consumed the deficient diet for only 16 to 39 days. Give me a break. Were they not eating? Human Krebs, in their discussion of this work, suggested that perhaps they were selected as likely to be deficient in vitamin A. Does this not look obvious, like brutally obvious? Wait, some people last 2 years. Some people last 2 weeks. Some people, they've been eating a low vitamin A diet for 2 years, and then in 3.5 months, they all start falling apart. Scientists need to make a living. And so if scientists don't find what their sponsors want them to find, sometimes they make sure that they find that. Or else they'll be homeless and their family will be starving. Science is probably one of the easiest fields to manipulate with money because they're all broke unless people give them money. Like, when have you gone out and donated money to fund studies? Okay. Oh, Joe says we should save something for the blooper reel. Yeah, there we go. Okay, so that's that. Here we got to expose more of them trying to protect against pharmacoeconomic implications, right? Okay, now JAMA Network. Journal of the American Medical Association. Vitamin A requirement of human adults, an experimental study of vitamin A deprivation in man, a report of the vitamin A subcommittee of the accessory food factors committee. Okay, I'm going to do something, you guys. I haven't done this on the live stream yet, but I do have a standing desk and my butt is getting tired. So we are elevating the desk. This is just one of those Costco things. It's nothing fancy. It's good value, actually. Oh, this was the one. Yeah, this was the one I went over already. Indisputable evidence of deficiency did not appear until after 8 months. Ultimately, unmistakable deficiency developed in only 3 of the 16 volunteers who persisted in the test for 12 to 24 months. Wait, these other things that they say are vitamin A deficiency things. This is that group of 23 people. Follicular hyperkeratosis, conjunctival degeneration, and abnormal fatigue were not encountered. So this is just an expansion of that 23-person case study that I talked about. 1949. So apparently they thought it was safe enough that they could put people on a low vitamin A diet. Am I too high now, Joe? Hold on, let me look at my video. Oh no, I'm kind of high. Okay, there we go. Now we're back in it. Okay. Let's go into what happens when they find a bunch of people who are vitamin A deficient and they have no symptoms. Vitamin A deficiency in Latin America and the Caribbean, an overview. So I have this whole PDFs in there from the Google Drive. Let me see if I can find what was the quote. Let me see. Can I search this? I don't know if I can search a Google Doc. Ocular. Yes. Here it is. In most countries of the region. So this is like Latin America and the Caribbean. However, vitamin A deficiency, they were finding vitamin A deficiency all the time. It was not considered a problem of public health significance because ocular lesions leading to permanent blindness were not frequently observed, despite prevalences of low serum retinol hovering near the cutoff of 15% then recommended by the World Health Organization. There was lots of vitamin A deficiency, yet they weren't seeing eye problems. Strange. In large populations. Okay. Let's go into this one. Retinol deficiency and urinary stone disease. Clinical evidence is missing. Why is it missing? Serum retinol levels were studied in A, 95, 56, and 43 normal subjects belonging to lower class, 95 of them, middle class, 56 of them, and 43 upper class socioeconomic groups, respectively. They also studied 35 adult males suffering from night blindness, 27 subjects with low retinol levels, 8 retinol deficient subjects. Oh, so that's low. Low would be like the 0.7 to 0.35 to 0.7. And I guess deficient would be below 0.35 if we're talking about the European, the metric units. 17 male infants suffering from an overt retinol deficiency. 43 radiologically, so that's X-ray confirmed kidney stone patients. And age and sex matched controls. So 120 adults and 20 infants. It was found that 68% of subjects in lower socioeconomic group, as in they probably don't eat a lot of meat, had serum retinol levels between 10 and 19 milligram percent. That's the American range. So below 20 is deficiency. And they're saying 68% of them were between 10 and 19, so they're deficient, and 4% of them were below 10. But none of them showed any signs of retinol deficiency. Let's just keep going. Oh, and then they were trying to show that vitamin A deficiency would cause kidney stones. That's what they were really interested in. None of them showed radiological evidence of urinary stones. Thus, our results do not support an association between retinol deficiency and urolithiasis in this population studied. They go searching for diseases to connect to vitamin A deficiency. Because when they find lower socioeconomic groups who can't afford meat, they find low vitamin A in them. And then they go, oh, this disease has to be connected. And they find out that it's not. Okay, let's find some babies with zero vitamin A in, oh wait, why did it do that? With zero vitamin A in their liver. Where was it? Let's do find 0 to, oh, come on. 320. There it is. Sorry, I could have just jumped to it. Pay attention here. Vitamin A is so necessary for growth and development, right? The mean, as in the average liver stores of vitamin A in children 1 to 10 years of age, have been reported to range from 171 to 723 micrograms per gram. Okay. Whereas the mean, the average liver vitamin A stores in apparently healthy infants is lower, ranging from zero. What? Wait, how much is zero? It's none to 320 micrograms per gram of liver. Apparently healthy infants, zero vitamin A in their liver. The hits just keep coming. So again, zero vitamin A in their liver, apparently healthy infants. Zero vitamin A in their liver, apparently healthy infants. Infants being born with zero vitamin A in their liver, healthy. Why were their eyes not missing? Why did they just spaces where their eyes go and their skin falling off? Zero vitamin A. Effect of vitamin A depletion in young adults. This might be is this the 23 people? No, this is a different one. Oh, was there 7 seconds of me not talking, Joe? I don't know. I guess we're having some technical difficulties. Maybe they're attacking us because I'm speaking too much truth. Joe, let me know when I'm talking again. Let me look at my picture. I mean, I don't know if you're hearing silence or you hear me now. Okay, great. Well, I don't know if you guys heard me. If you did, great. If Joe couldn't hear me, I don't know. Effects of vitamin A depletion in young adults. Let's go over this because this is a different one. 6 university students. Let me see if I can zoom in one more. Ranging in age from 20 to 24 years were placed on a vitamin A low diet, not a zero, for 31 and 20 weeks respectively. So I guess they're saying that the women were on 31 and the men were on 20 weeks. I don't know. Diet contains 67 to 100 USP units of vitamin A per day. The foods furnishing any vitamin A or source thereof were weighed and consumed in equal amounts by all, with the exception of meat, of which the men received 1 1/2 times as much as the women. Joe wants me to repeat the vitamin A in the liver. We're going back to this one. So remember, this is, let's go back to this part. Chapter 4 of vitamin A. The dietary reference intakes for vitamin A, vitamin K, arsenic, boron, chromium, copper, iodine, iron, manganese, molybdenum, nickel, silicon, vanadium, and zinc, 2001. This is like, I don't know if this is from the National Academies. I forget. I don't know if this is like a WHO or an Institute of Medicine kind of thing too. But I'm just going to say this whole thing again then. Okay. They say that we need vitamin A to properly develop. The average liver stores of vitamin A in children 1 to 10 years of age has been reported to range from 171 to 723 micrograms per gram. Okay. Whereas the mean, the average liver vitamin A stores in apparently healthy infants is lower, ranging from zero, Healthy infants, 0 to 320 micrograms per gram of liver. Somebody go tell Weston Price. 0 vitamin A in their liver. Apparently healthy infants. Their skin is not falling off. Their eyes are not falling out. They don't have diarrhea. 0 vitamin A in their liver. Healthy infants. How are they going to argue that? Does that mean the mom had 0 vitamin A too? How'd she have a baby? Oh, wait. Dr. Smith says vitamin A is an infertility agent? Wait, so maybe that mom was really fertile. Wait, we help fertility around here by getting moms off vitamin A and getting the dads off vitamin A. And what's the only vitamin that's really known to cause a lot of problems in pregnancy? Oh, it's vitamin A. Hey, that's crazy. So let's go back into this paper. So the guys got 1.5 times as much meat as the women. Oh, the flour used for cooking and baking was enriched. So that means it was probably white flour, but they did enrich it, right? With the good old niacinamide, the BS niacinamide, and the iron, what are they, ferric? I don't even remember what the crap type of iron. If they fortify a food with it, don't eat it. They don't fortify food with flush niacin. They fortify food with niacinamide. Okay. Wait, whoa. Oh, one of the women were the control, and she got halibut liver oil capsules in addition to the low vitamin A diet. Anyway, let's see. What was I going to look at on this paper? The 2 conditions. So, it's the conclusions. We're going to the conclusions. Let's skip ahead. Pay attention here, vitamin A lovers. 5 young adults, 3 women and 2 men, were placed on a vitamin A low diet for 7.5 and 4.5 months, respectively. At suitable intervals, measurements were made of dark adaptation, night blindness, blood vitamin A and carotene, total white blood cell counts, and differential blood counts and changes in the structure of skin and conjunctivas. None of these measurements showed any definite changes from those found prior to the deficiency for the length of time studied. It appears then either that these subjects had sufficient stores to withstand the effects of the depletion diet, or that these signs that are said to be vitamin A deficiency are not merely the result of uncomplicated vitamin A deficiency. Maybe it's protein deficiency, zinc deficiency, taurine deficiency. They literally starve people of vitamin A and they can't cause the problems that they say are should be caused. Let's go to this next one. I'm not a robot, I promise. Somebody thought I was doing AI on my reels, and I'm like, oh no, we're not doing AI on reels. Is this gonna show up? Okay, there we are. I really want you to pay attention to this study because this was back close to when vitamin A was discovered. 1923. They didn't even call it vitamin yet. They called it fat-soluble A. The pathological anatomy of ophthalmia, as in eye problems, produced by diets containing fat-soluble A, but unfavorable contents of certain inorganic elements. Those are called minerals. So wait, they're saying the cause of eye problems in diets that contain enough vitamin A, but have bad amounts, ratios of good or maybe even bad minerals. Manchuria. Hey, at least, yeah, that's probably why they were able to study this stuff, because they were far enough away from the Rockefellers. The 2 conditions. Let's see if this is actually searching. Here we go. The conclusions. Xerophthalmia, which is dry eye, and keratomalacia, that's the problem that comes about from dry eye where you start scraping your eye with your eyelid, are produced in rats by feeding them diets which are deficient in fat-soluble A. Debatable. Anyway, the same changes may result from the consumption of diets which have... this is a Latin saying that means all else things considered equal. An abundant supply of fat-soluble A, but which contains certain unfavorable salt mixtures. The two conditions are clinically and pathologically identical and are identical with human xerophthalmia and keratomalacia. It would seem from the foregoing experiment that in cases of xerophthalmia which occur in human beings, other factors than fat-soluble A deficiency may have to be considered in regard to the etiology, the cause of, and the treatment of the condition. They just said you can cause dry eye and keratomalacia with a mineral deficiency. That's what they're saying. Let's see what the mineral, do they show the mineral preparation? Oh, wait. Oh, yeah. Okay. Here's an important thing. Where was it? One rat in which keratomalacia had been produced, right? They got enough vitamin A. I'll define, Joe, if you want to find a definition for keratomalacia and put it on the screen, go ahead. One rat in which keratomalacia had been produced. So they did the unfavorable salt mixture, which means minerals, was placed on a diet containing a good salt mixture after both cornea had been literally perforated by the ulcers in the eye. The activity of the pathological process was stopped at once clinically as a result of the change. Photophobia disappeared, as in photosensitivity disappeared. The discharge diminished, the discharge that was coming out of the eye, and the conjunctiva became moistened. However, since the cornea had been perforated, vision was permanently lost. Like it went too far. The eye had been too damaged. But all the problems in the eye that were ongoing all went away immediately. Pretty wild, right? So was it vitamin A deficiency? No. Was it probably zinc deficiency? Yeah. Do you know that they didn't figure out rats and mice actually needed zinc until like 1934, I think it was? So they find vitamin A in 1923 or something like that. And they don't figure out that these study animals actually need zinc until 10 or 15 years later. The whole vitamin A thing is based on BS. I don't know if it could have been planned any better to be such a farce. Okay, now we're just going to go over we're going to go two other things. We're almost done. And I am hitting only super chats if they're there. Otherwise, I'm wrapping it up. I want to show you how people can have liver toxicity while their serum retinol, while their blood vitamin A is deficient or low. I want to show you that this exists. Let me close out all of these. Okay. Sorry if today's boring. Okay. Hey, here's the paper by Anthony Mawson. One of the greats. The role of fat-soluble vitamins A and D in the pathogenesis, the disease creation of the flu. A new perspective. Let's go find that real quick. Wait, where's it? There it is. I need to get that AI companion stupid thing out of there. Serum retinol concentrations, normally 1 to 3 micromole per liter, do not reflect liver vitamin A concentrations over a wide range of liver values. since the secreted retinol binding protein is under homeostatic control. So what they're saying is, if you go to your doctor and you ask them to run a blood vitamin A test on you, and you assume, or he assumes, or she, or whatever, assumes that shows how much is stuck in your liver, no. It doesn't work that way. The research has never said that. And remember how crappy I showed you the vitamin A tests were before. Pay attention here. Thus, serum retinol concentrations vary little despite major alterations in vitamin A intake. This is the plateau that you saw in some of those papers that I see and Kelsey and I see in serum retinol levels all the time. What we see is the plateau oftentimes, and then all of a sudden it falls off a cliff because your liver ran out of vitamin A. And people didn't feel bad, they feel better. Okay? Case reports of hypervitaminosis A, vitamin A toxicity, often show serum retinol concentrations within the normal limits, indicating that serum retinol is not a valid measure of vitamin A status during toxicity. Research on vitamin A toxicity has been carried out mostly in animals, but observational studies, pay attention here, suggest that more than 75% of people in developed countries routinely consume more than the RDA for vitamin A. Why are we even talking about vitamin A deficiency in a developed country when our own FDA says vitamin A deficiency here is rare? Why are we listening to people like Chris Masterjohn and Stephanie Seneff and the Weston Price nonsense knuckleheads? Everybody's getting plenty of vitamin A. Children are particularly sensitive to vitamin A, which is why all the Weston Price kids are all allergic as heck. Because vitamin A is the root cause of your allergies. So, oh yes, let's go into this. Yes. This paper shows it exactly. Reversible hepatotoxicity, reversible liver toxicity associated with hepatic vitamin A accumulation, too much vitamin A in the liver, in a protein deficient patient. Okay, this is a real world example, right? So we went over how when you don't get enough protein, you're not getting enough protein, you're not getting enough zinc, you're not getting enough taurine. This guy was probably a vegan or something nonsense. And he had low vitamin A in his blood, but super duper high vitamin A in his liver. We're going to go over this. A 62-year-old white male presented with edema, so he's swollen, sign of not enough protein. Protein malnutrition and abnormal liver function. What did he do too? He wasn't eating enough protein. He had ingested from 40,000 to 50,000 IU of vitamin A per day for 7 years. The biggest problem with vitamin A toxicity is that it takes forever to accumulate. So people are just like, well, I've been taking this for years. It hasn't caused me any problems yet. And you're like, how many times you got to get shot with a 22 before you fall down? It's not going to hurt you very much. You can take a bunch of them. They all hurt, but it takes a lot to put you down. Examination of the liver tissue by light and electron microscopy revealed findings characteristic of an excessive accumulation of vitamin A. Liver tissue contained massive amounts of vitamin A, 19,000 units per gram. However, both the serum concentration of vitamin A and retinol binding protein were below normal, and serum retinol binding protein was not saturated. He had low vitamin A in his blood and massive amounts of vitamin A in his liver on a protein deficient diet. Do they measure the vitamin A in your liver? No, they don't. Not usually. This guy had such liver problems that they literally did biopsies on him. They did multiple biopsies on this guy. On a normal diet. So what was this guy on then? He wasn't on a normal diet. The patient was able to mobilize liver vitamin A, as indicated 71 days later by a repeat biopsy of the liver, which then contained 9,000 units of vitamin A per gram. So we got it down by half in 2.5 months. During this time, his nutrition improved. What was he? They never say what he was eating. Serum vitamin A rose. Wait. I want to make sure. His liver vitamin A went down by half. His vitamin A in his blood rose. So blood vitamin A rising is literally part of the detox process for somebody who was protein deficient, zinc deficient, taurine deficient. Do you understand? How could the blood vitamin A go up and the liver vitamin A goes down, and then they think that zinc is fixing a vitamin A deficiency or protein's fixing a vitamin A deficiency because it makes it go up in the blood? No, zinc and protein and taurine are helping you protect yourself from vitamin A, and they're helping you detox vitamin A. That's what this is showing. Okay. And then they say here, the amount of vitamin A ingested by this patient, this is the COPE, right? Don't stop taking your vitamin A, folks. The amount of vitamin A ingested by this, that was sarcasm. Sorry, that was sarcasm. The amount of vitamin A ingested by this patient was less than that, usually producing recognizable liver toxicity. And he had no extra hepatic, as in other than liver symptoms. So his liver was probably practically failing, but he didn't have any other problems of vitamin A toxicity consistent with a low serum vitamin A concentration and a low vitamin A to retinol binding protein ratio. So he had low retinol binding protein because he didn't need enough protein and zinc and all that stuff. At presentation, he was apparently unable to normally mobilize vitamin A from his liver, so he couldn't detox it, which may have been due to an accompanying protein deficiency. Okay, I want to show you the numbers now. He had no vitamin A deficiency symptoms. His liver was full of it. His blood was low in it. He had no vitamin A deficiency symptoms that they mentioned. They would have mentioned it if he had vitamin A deficiency symptoms. He had none. No extra hepatic manifestations of vitamin toxicity or vitamin deficiency. So, excessive vitamin A intake. What are some of the most common symptoms? We'll just go over that. Loss of hair loss, dry skin, itching, chelosis, gingivitis. How many people have gum problems? Headache, anorexia, not losing their appetite, fatigue, muscle and bone pain. How many people out there have muscle pain? Okay. Characteristic liver histology includes parasinusoidal fat deposition. Wait, depositing fat in the liver. Fatty liver. Oh, excessive amounts of vitamin A within the liver may result in collagen deposition, scar tissue formation, and development of cirrhosis. Why do we have the Love Your Liver program and we're against vitamin A? I don't know. You make the connection. Let me find the numbers. Here we are. This is the same units that we use. So this guy, in the weeks after admission, second week, they did a blood vitamin A test on him. He was at 18. Okay. In that first week or third week, his liver vitamin A was 19,700 units per gram. They called this a massive amount. So we have deficient vitamin A in the blood and a crazy amount in the liver. He goes on a low vitamin A diet. They stop him on all the supplements. And he goes and he eats more protein. Well, in the 10th week, look at what his vitamin A did. It went from an 18 to a 62. 18 to a 62. So he went from vitamin A deficiency. See, they're even saying here the normal vitamin A range that they give is from 30 to 65. So by their standards, he's still normal. But I'm going to tell you, the old standards for like LabCorp, when I first started doing this, were like 54 or 56. And because I've told you, they adjust the ranges based on the population. The population's getting more toxic in vitamin A. So the blood levels over time are going up, and they keep raising the high end of the vitamin A level. They're up into the 60s now, 62, 65. They're trying to hide it. There's 3 types of lies in this world: lies, damn lies, and statistics. He went from deficient to toxic. He went from super duper toxic to less toxic as his vitamin A went up in the blood. Okay. His liver enzymes almost came back down to normal. Well, they did for a bit. His SGOT, which I believe is SGOT, is ALT, SG. I forget which one. SGPT is either ALT or AST, and SGOT is the other one. I don't remember the European ones. I like the freedom units. Anyway, so if you go and you say, well, my it's like when people are like, well, I tested my nickel in the hair, doc, and it was low, and I'm like, that doesn't mean anything. It's not coming out yet. Actually, I have a hair test. I didn't go over it today because I'm going over so much stuff here, but I did a hair test recently. If you guys saw my video where my hair nickel like jumped like 7 times higher off the charts, oh, it literally went even higher than that. I'm dumping more nickel than I've ever seen anybody dump. Kelsey recently did a hair test. Her titanium went from like a 0.001 to a 0.042 or something like that. It went up 42 times. We are figuring out the detox, folks. Nickel is a huge part of it. We think what there is there's like a detox order that the body goes through. The body's going to detox certain metals first. So if you're expecting to see something on your hair test, first of all, if you don't know how to read hair tests, you shouldn't even bother. They're not like just up and down. No, it's not like that. And no, the ranges on the hair test are not the optimal ranges. So my plan is to teach seminars in the future on how to read this stuff. But if you want hair tests to just be linear and just go the right direction just because you're doing stuff, it doesn't work that way. It just doesn't. It doesn't matter what you want it to do. It just doesn't do that. So you got to know how to adjust along the way, and you got to know what's significant and what's not. What do we freak out about? What do we not? And then there'll be the people who say hair tests are worthless. And I'm like, wow, it's weird how I'm getting so many people better. And Kelsey's helping so many people. If our tests are worthless, sometimes you got to know on your tests what's detox and what's not. Because detox will raise things. Like, why did my nickel go off the chart? Was it because I was eating more nickel? No, it was obviously the opposite. Okay, well, that's this paper. And one more thing from the NIH. Not that I'm a big fan. You guys should know that. However, now let me tell you something. If there was, let's say, if the purpose of a system is what it does, and if the purpose of this system was to create vitamin A toxicity as much as they could, and if people were like me, were starting to catch on that this vitamin A toxicity thing was happening, what might be one thing that the people in charge could do to the food to make it so people are less aware that they might be poisoning themselves? They could remove the requirement that they used to have to label the nutrition facts with the vitamin A content. We're just going to take it off of there so people don't know. People are too lazy to go look it up on the internet, most of them. So if we don't put it on the food, they can't even keep a running total in their head of how much they might be eating in a day. Relatively recently, the FDA does not require food labels anymore to list vitamin A content unless vitamin A has been added to the food. But I can tell you, they add beta carotene as a coloring to foods all the time now, and they don't count that on the label. So maybe it's not. If it's added as a color, they don't have to tell you. So let's go find the next one. Vitamin A deficiency. Frank vitamin A deficiency is rare in the United States. Okay. What do Americans eat a lot of that we talked about today? Meat, protein, zinc, taurine. All three of those things have been shown to raise the vitamin A in your blood. Why would they then say that we don't have a problem with vitamin A deficiencies? Because they look at those numbers and they see that your vitamin A is in the normal range. And then, but why would they remove this from the labels? Because if deficiency doesn't exist, the only thing that's left is toxicity. That's it. So, that's all I got. So anyway, let's go back to this doc real quick. Just so if you guys want to see the references that I went through, some of them are on my Google Drive. They're all right here. 7 pages of references. If people want to argue this, that's fine. They'd have to be pretty delusional to just deny all of this. We can put it together and we can benefit. We can help other people with this knowledge. Yeah. So hope you guys had fun in the chat. Joe, unless there's any super chats, y'all, I'm not even checking the chat. I'm already at four-ish hours, close to 4 hours. What, 3 hours and 25 minutes? I'm kind of done. So I'm gonna go through the links now, unless Joe throws a super chat my way. So here we go. No more super chats. Okay. But did I hit that one? I did that one pretty good, right? Oh yeah, I hit the retinol one. Yeah, actually here, let me do this. Let me do this real quick. I don't know if it's, hold on. Let me, oh, I can't, I'm not going to pull that up right now. No, we're done. I'll do the magic vitamin A. I got to have Kelsey find me the paper. When she sent it to me, she's like, magic vitamin A, like for real. And I was like, oh my goodness. So let's just go through it now. So reminder, our website has been redone. It just went live last night. So pretty exciting day. So if you want to go check it out, go check it out. If you find any glitches or bugs, we know that the VIP store, at least early this morning, like 5 a.m. this morning, there was some issues with the VIP store. They should be gone now. Hopefully they're gone now. But if they're not, we are aware of that one. If you want to let us know, you can, but there's no need to flood us with emails. We're fixing it. The VIP store, why is that important? Because that's our private password protected store for the Love Your Liver members, where they get discounts on all our stuff. So otherwise, we got our shop, which is the normal store for all our supplements. We got the membership, which is the Love Your Liver program. We got the consultations where you can get hair testing and blood testing and do a consult with Kelsey. If you want to see more testimonials, we got testimonials up the yin yang. And then under the shop, I believe, is where the instructions for the supplements are. I believe that's a drop down under the shop. There they are. There's the product instructions. So I got to fix all my text things for now. So that's where you can find all the instructions that I wrote. So let's move on, Joe. Let's head into the Love Your Liver program. If you want to go directly there, this is where I'm still updating all the stuff in there. I got to update it with all the nickel detox stuff and all of that. I'm right now, I've been working on the database of all my stuff. Like I'm literally making a database of the Love Your Liver program, of the old research forum, of my GLASP highlights. I just added my GLASP highlights to it last night. I'm adding our 7,300 plus research study database to it. I've added that. Like I'm adding all of it so it can all eventually be searched. Now I just got to start getting the transcripts from all of my videos. And then I want to put all of those in there, and it's going to be like the biggest brain dump ever. It's awesome. So anyway, and then I may figure out ways to allow, the Love Your Liver program people to access that. So Joe's showing the GLASP right now. That's GLASP. That's what I use today to highlight all the studies, and it collects all the highlights. So like all of these highlights are going to be put into my little database. Joe's been very proud of me for figuring out how to do all this stuff. Yeah, I did ask ChatGPT for some help on it. Of course I did. I don't know how to do any of this stuff, but it's working. And yeah, so it's pretty exciting. What else do we have on the website? You can find the free email course, the madnessofmodernnutrition.com. I believe we sent it to you in a PDF. And if you want to get our newsletters, I'm going to be working on another newsletter today to announce the newest Inner Circle archive that was put up last night. So we'll send that out. You're probably watching this here on YouTube. There's my YouTube channel. We're growing. It's great. It's awesome. And I get to film some more reels tomorrow too for all of that. Rumble. Oh, so just so you know, on YouTube, sometimes so if you guys were wondering, like last week, sometimes I slip and I say words that are not okay. So I have to take it down. So if you ever didn't get a chance to watch the live stream and you click on the links I put up and it's not there, what that means is I probably said a naughty word or two and I had to take it down, edit it, and put it back up before the Gestapo would give me a warning or a strike. I've been very good about avoiding those for all these years. I actually realized I don't have a strike on my channel. I just have a warning. So you can get 3 strikes in 90 days before you get booted. So I don't even have a strike yet. So I've been doing pretty good. Anyway, if you want to see all the unedited episodes, and at episode 198, which is what got me my warning, those are all on Rumble over there. So Rumble's such a weird place, man. Anyway, Twitter. If you're on Twitter, you could find me on Twitter, and you can mostly see my threads and my we're posting the reels there too. I'm not active on Twitter, so don't like tag me and expect a response. That is, every time I go there, I'm just like, this place, man. Instagram. If you want to see the reels, that's where the.real nutrition detective. Facebook, the same handle, the.real nutrition detective. TikTok, @nutrition detective. Substack, especially once I start getting the database going and I look at some of my old articles, I'll be posting stuff on Substack. I don't know. I may even try to see what I can do with all the research I put up today to consolidate it and maybe make a Substack article out of it. I don't know. And a blog post and whatever. Okay. In the Love Your Liver program, Beth Martins. She was probably here in the chat, but I think she probably had to go do her, do this. Was this on? I don't remember if she does these today or tomorrow. I think she does them on Wednesday. Anyway, inside the Love Your Liver program, once you're inside the Love Your Liver program, she does once a week. She does a group, small, Zoom, small group, deprogramming your health session. It's free once you're in the Love Your Liver program. Or you can choose to, if you want to work with her privately, and I'll tell you, Kelsey and I did a session with her together yesterday, and I think it was really, really good. I utilize Beth's skills myself. So does Kelsey. So, so it's there if you want. She does good work if you're into that kind of stuff. Okay. Well, Beth has some news. She has to run, but she wanted to give a heads up that tomorrow will be her last deprogramming your health session in the Love Your Liver program for now. Okay. I just found this out now. So, but recordings will still be available in the House of Free Will for a time. Okay, cool. I don't know why that is, but I'm sure Beth has very good reasons why. So anyway, so that it's there for this week. So if you haven't done it yet, I would jump in. We have the Revive Mouth Guard. This is something that's if you're into the fixing your skull shape. And if you looked at the old video of me, the old vitamin A deficiency doesn't exist video, and you saw my face and my skull shape and all that stuff, and you see me now, Part of that is the Revive. Part of it's I did some mewing. Part of it's the Myo nozzle that I use on my water bottle. If you don't know which water bottle to get, it's on Amazon. PROBTTL. PROBTTL, and the one with the straw. And then you can put the Myo nozzle on it. You got a glass bottle. There's no nickel. Yeah, the straw is plastic. Pick your poison. Okay. But yeah, if you want to get a discount on the Revive, highly suggested. Spurty lamps, if you live somewhere dreary and you want to get a sun lamp, you don't want to have to do a whole tanning bed and you just don't have sun, Spurty lamps are good. You can get either one of them works, the sun lamp or the vitamin D lamp. They both have UVB and they both have UVA. Oh, this was what Joe was showing earlier, the GLASP. If you want to search the GLASP highlighted abstracts, the extracts of the abstracts. So if you want to go search those, you can just go here and see that's my account, and you can type in the search thing and find the highlights that I did today. You can find the ones from today. As soon as I highlight it, it's in there. And wrapping it all up, I am Dr. Garrett Smith, the nutrition detective. I like to think I made it fairly evident today with, so if you go and you watch the old video of this, it's probably only half the stuff of what I went over today, because I wanted to hammer this home. This was not a video for people's entertainment so much. I mean, I try to make it entertaining, but this was to bash people over the head with how bad this science is on vitamin A. And people will nitpick and they'll okay, that's fine. You like your vitamin A? You can keep your vitamin A. You like your disease? You can keep your disease. Yeah. So, vitamin A deficiency doesn't exist, right? With a question mark. We don't want to make too grand of statements, or we might get in trouble with the powers that be. Anyway, Love Your Liver 263. Hope you guys enjoyed it. I will see you all next time. Bye now.